and welcome to the Senate Committee on Judiciary the evening of Tuesday, May 9th. We have a lengthy number of members of the public who've signed up to testify this evening. So a little bit of housekeeping before we start. I do want to note that we do have a quorum. And how we're going to run the hearing tonight is that first up, we're going to allow each sponsor to introduce their legislation. We're going to take the bills in the order that they are on the committee agenda. Each sponsor will be able to introduce their legislation, and then we'll field any questions that the committee members may have. We'll move through each piece of legislation that way in turn, and then we will move over to public comment. And I will ask the members of the public, I think when you signed in, you indicated on that sheet where you were on all of the bills, so you don't need to repeat for us which bill numbers you're testifying for and against. We do have that information. So when you come up to testify, simply tell us your name. If you're representing any organization or just yourself, you can go ahead with your testimony. We are going to keep a time limit of 3 minutes for each witness of the public. So I just ask that people be mindful that we do have a lot of witnesses here from the public to testify, and I want to make sure that everyone has their opportunity to be heard in front of us. And then after the members of the public, any committee members, if they have any questions, will be able to ask questions after every public member is able to testify. So with that little bit of housekeeping, we are going to move over to Senate Bill 32 by Senator Valverde. Senator Valverde, welcome to the committee. And two more housekeeping notes before you start. My apologies, Senator. We do have a line waiting outside, so a couple things. One, we do not allow signs in the committee room, so if you have signs in the committee room, please keep them under your seat. And when you're done testifying, please leave the room. We have a number of people outside that are waiting, so we're going to try to cycle people through the hearing room so that way we don't have to wait while people are coming upstairs from the bell room. And with that, over to you, Senator Valverde. Thank you.
Thank you, Chair Oyer, members of the committee. So a lot of you will remember in 2019, we passed the Reproductive Privacy Act, which protected the right to abortion here in Rhode Island. As we now know, securing that right was absolutely critical. Despite the Dobbs decision by the Supreme Court, abortion thankfully remains legal and available in Rhode Island. But we are still leaving so many people without access to the full range of reproductive care. We all know that if our health insurance doesn't cover something, it is much harder for us to get that care that we need. And right now, Rhode Islanders who rely on Medicaid, so that's people with low incomes, people with disabilities, current and former foster youth, along with our state employees and their families, are prohibited by law from using their health coverage to pay for abortion. They are left to cover the full cost of care, or in many cases delay care or just go without completely. Senate Bill 32, the Equality in Abortion Coverage Act, will fix this and end decades of inequality, decades of discriminatory restrictions on health coverage for abortion. These current bans affect a lot of people. A full quarter of Rhode Islanders rely on Medicaid or a state health plan. And that number includes roughly 85,000 people who may become pregnant. By denying them abortion coverage, we are interfering with their right to make the reproductive health care decisions that are right for them and their families. And we interfere with our health care providers' ability to provide quality care that their patients need in a timely manner. The entire point of Medicaid is to provide health coverage to individuals and families who could not otherwise afford it. Pregnancy, childbirth, and child rearing, as many of you know, come with some fairly steep economic costs, not to mention the health risks. And so it is cruel and unjust to make it more likely that Medicaid patients will be forced to continue with an unwanted pregnancy. Because of these bans, people who can least afford it are forced to use their limited funds or borrow money from friends and family or rely on the kindness of strangers to pay for a service that is a standard covered benefit in private health insurance plans. And there is a reason that it is a standard covered benefit in those private plans. It is because allowing people access to abortion is sound health and economic policy. These coverage restrictions are not around because it's cost effective to deny care. It's never been about the money. It is about controlling people, mostly women, mostly poor women, mostly women of color, immigrants, people with disabilities, the very people who have not enjoyed the most power and privilege in this country. Senators, we should not be in the business of controlling our constituents' private healthcare decisions. I'm sure that once again this year, you will hear from some people who do not want their tax dollars to pay for abortion. That because they oppose abortion, they should get to personally withhold funding for it. But we all know that that's not how public funding works. I know that some of you would not choose abortion for yourselves or your family members, and that is your right. But there is no individual right to determine the precise things that public funds pay for, especially when it comes to health care. We've decided as a state that as many people as possible should have health coverage, regardless of ability to pay. And so we use our tax dollars to pay for Medicaid. The state of Rhode Island is an employer. It provides its employees with health coverage, as it should, and our tax dollars pay for part of it, minus, of course, the premiums and the high deductibles that employees pay for themselves. But the message that we are currently sending to people on Medicaid and to our state employees is that because you are poor or because you have chosen state service, that you do not deserve the same access to care as others. It does not make sense to maintain specific carve-outs in our insurance laws to deny coverage of abortion, a safe and legal medical service, just because some people don't think that anyone should have one. There is no other safe and legal medical service that is treated this way. Since the Dobbs decision last year, many states have enacted laws that take their healthcare systems backwards and make things more dangerous for women in their childbearing years. We have a chance here to strengthen access to reproductive care in Rhode Island. We have a chance to finally join the 16 other states, including Massachusetts, Connecticut, Vermont, and New York, that ensure that everyone has access to abortion, free from politically motivated financial barriers. The House has already acted on this legislation, sponsored by Whip Kazarian, and they passed it with a large majority that reflects the overwhelming public support for it. I hope that this committee will allow our chamber the chance to debate this bill on the floor and win passage as soon as possible. So I thank you for your time, and I'm happy to answer any questions.
Thank you, Senator. Are there questions for the sponsor? All right. Leader Dela Cruz.
Thank you, Senator, for coming tonight and introducing your legislation. You stated in your presentation that the law it's prohibited by the law to provide abortions for women on Medicaid and those that are employed by the state. But we do, in fact, provide abortions to that population currently, and have for one statute for 41 years and another one about 30 years now. So, and those are in the instances of rape, life of the mother, and incest. So it's currently not prohibited by law. You also mentioned that there was overwhelming public support. So I haven't gone through the entire stack of testimony, but I've gotten through about half of it. And, you know, there are individuals who support your legislation. Most of the testimony here are from large organizations. And so far, this is the against and this is the for. So when I look at, you know, when you say overwhelming, I'm not sure that that's, at least with the testimony that we've received, entirely accurate. And I just want to point out that when I do talk to individuals, Democrats, Libertarians, Republicans, many of them do not support their tax dollars going towards elective abortions. The consensus has been amongst Democrats and Republicans in government and in the public that we do need to provide abortions in the instances of rape, incest, life of the mother. But when it comes to elective abortions, those out of convenience or a method of birth control, that's where they draw the line. And I tend to agree with those individuals. So I just was wondering, how many, do you know how many people were denied abortion coverage through Medicaid or through the state employees? Were there any denied abortion coverage?
I do not have those figures.
Okay, no, that's okay. How much of an increase in abortions can be expected if this legislation passes?
I mean, it is hard to predict that kind of thing. Some people do still get abortions, but that is something that will have to be, that's been estimated by the Department of Administration, and Governor McKee included an amount in his budget to cover the costs of those procedures. But I think that we will have to see.
Okay. Is birth control currently provided at no cost for women on Medicaid?
It is.
Okay. So that's pretty effective. I think most birth control methods may be 99% around there. So
Birth control fails all the time, Senator.
what's that?
Birth control fails all the time.
Not all the time, but occasionally it does.
Often.
Let's see. I think that's all for now. Thank you.
Great, thank you.
Are there any other comments or questions for the bill sponsor? I don't see any. Thank you, Senator Valverde.
Thank you, Chairwoman.
Next up, we have Senate Bill 298 by Senator Dela Cruz.
Thank you, Chairwoman. 298 pertains to licensing of healthcare facilities. This legislation would require the Rhode Island Department of Health to conduct yearly inspections of licensed healthcare facilities that provide for abortions. It also requires that licensing of healthcare facilities are of the same as all other healthcare facilities. And lastly, it permits the Department of Health to conduct unannounced inspections of these facilities and revoke licensing for deficiencies. When I reached out to the Department of Health, I could not get a clear answer on the issue of inspection, so I filed an APA request. The response I got was that abortion clinics are licensed like other healthcare facilities, and that there were no records of inspections available, hence the reason for this legislation even more critical. Under Rhode Island law 32-17-12, the Department of Health is specifically authorized to conduct unannounced inspections of nursing facilities. This holds the facilities accountable, and there are major consequences for deficiencies. My legislation would specifically require abortion facilities to have a standalone statute for inspections and unannounced inspections. We all have heard horror stories about Kermit Gosnell in Pennsylvania and other horrific issues surrounding abortion clinics. Rhode Island is a state where our legislature saw fit to expand the ability for women to have abortions in 2019, and with that comes the responsibility of pervasive regulation. Right now, the Department of Health is telling me that abortion clinics are treated like a healthcare facility. While I do not subscribe to the often repeated abortion is healthcare, I do believe that we all want to protect women who access these facilities. If you do believe that abortion is healthcare, just like nursing home is healthcare, let's get this across the finish line with support from both sides on the abortion issue. Thank you.
Thank you. Are there any questions or comments for the bill sponsor? All right, seeing none, next we'll move to Senate Bill 347 by Senator Morgan.
Testing. Thank you, Madam Chair and committee members. We'll do them both? They're pretty much.
Yes, you can, if you want to introduce 347 and then I'll let the committee ask any questions, and then I'll have you do your next bill after that.
Okay, thank you.
Thank you.
I'm introducing this bill because there are hundreds of babies that are born alive that have to be medically taken care of when they are going for an abortion. This piece of legislation would basically put the doctor or the staff in charge, medically responsible for that infant that is born alive to actually save its life. And that's basically what this one does. And if they fail to treat the baby, then they could be, thank you. Then they could be penalized and held responsible for not giving adequate care to that infant.
Thank you. Are there any comments or questions for the bill sponsor? All right, next up, you have Senate Bill 392.
Okay. 392, again, it's the Born Alive Act. If a baby is born alive, what this would do, it would be the medical staff's duties and obligations to perform certain criterion on that baby to save its life. The legislation would provide for, it would actually be considered civil or criminal penalties if they fail to reach the standard of care that that infant needed, who was born alive. So, I mean, now it's just, it's a cruel type of procedure that happens to these babies if they're born alive. And I think that our children, our babies, are worth saving.
Thank you. Are there any questions or comments for the bill sponsor? All right, seeing none, thank you, Senator Morgan.
Thank you.
And the last bill on our agenda is we have Senate Bill 397 by Leader Dela Cruz. Leader.
Thank you, Chairwoman. Bill 397 was, I guess, birthed out of a floor amendment that I submitted in 2019. And it's the Rhode Island Pain-Capable Unborn Child Protection Act. Simply stated, it prohibits the performance or induction of an abortion of an unborn child capable of feeling pain unless necessary to prevent serious health risk to the unborn child's mother. I came across a bill in Congress that was passed in the House and the Senate. Unfortunately, in the Senate, they didn't have enough votes, even though they had the majority, they didn't have enough of the majority of votes. And they found in their legislative findings that, it says here, Congress finds and declares the following. 1, pain receptors are present throughout the unborn child's entire body, and nerves link these receptors to the brain's thalamus no later than 20 weeks after fertilization. By 8 weeks after fertilization, the unborn child reacts to touch. After 20 weeks, the unborn child reacts to stimuli that would be recognized as painful if applied to an adult human, for example, by recoiling. In an unborn child, application of such painful stimuli is associated with significant increases in the stress hormone, known as a stress response. Subjection to such painful stimuli is associated with long-term harmful neurodevelopment effects such as altered pain sensitivity and possibly emotionally, behavioral, and learning disabilities later in life. Also noted here and noted in 2019 on the floor in the amendment that I presented, for the purposes of surgery on unborn children, fetal anesthesia is routinely administered and is associated with a decrease in stress hormones compared to their level when painful stimuli are applied without such anesthesia. In the United States, surgery of this type is being performed by 20 weeks after fertilization and earlier in specialized units affiliated with children's hospitals. The position asserted by some physicians that the unborn child is incapable of experiencing pain until a point later in pregnancy, later than 20 weeks after fertilization, predominantly rests on the assumption that the availability to experience pain depends on the cerebral cortex and requires nerve connections between the thalamus and the cortex. However, recent medical research and analysis, especially in 2007, provides strong evidence for the conclusion that a functioning cortex is not necessary to experience pain. You know, I can continue to read the rest of the legislative findings. However, I will not. I think that I think everyone gets the point here that it would be cruel and unusual to induce pain on an unborn child And so with that, if anyone has any questions, I'm happy to answer.
Are there any questions or comments for the bill sponsor? All right, hearing none, before we move to public testimony, I'll entertain a motion to hold Senate Bill 32, Senate Bill 298, Senate Bill 347, 392, 397. Moved by Senator Lamont and seconded by Senator Coyen. All in favor? Aye. Any opposed? And the bills are held. Next up, we'll move to public testimony. Again, just as a reminder, I am asking folks to keep it to 3 minutes, and you can testify on all of the bills that we have before us today. First up, we have Lisa Cooley, Dr. Beth Cronin, and Dr. Anna Whelan. Do we have Dr. Beth Cronin or Dr. Anna Whelan? Can we check out in the hallway? Thank you. Welcome to the committee. Just make sure that the button on the microphone is up when you speak. And Dr. Cronin and Dr. Whelan, if you want to come up to the table as well, and you'll be next. Welcome to the committee. You can go ahead.
Okay. Thank you very much, committee members. Can you hear me? Okay. My name is Lisa Cooley. I'm from the Diocese of Providence, the Office of Life and Family. I do ask you to please support all the pro-life bills that have been put forth. To me, they are absolutely common sense. And the sad fact that some of them do not get passed is very revealing of the godless culture that we find ourselves in right now. But I'd like to spend some time speaking on Senate Bill 32, that taxpayer-funded abortion through Medicaid. Just a reminder, like Senator Jessica De La Cruz said, that abortions that are medically necessary are already covered by Medicaid. And why is this? It's because they are actual health care. Elective abortion is not medically necessary and is not health care. It destroys a life. Elective abortion is, most Rhode Islanders will agree, like Senator Jessica De La Cruz mentioned, maybe they don't believe in abortion, but they won't stop anybody else from getting one, but they don't want to be complicit and they don't want to participate in it by paying for it. They don't want to be responsible in that aspect. And by forcing us to pay for other people's elective abortions, you make us participants. It is a religious liberty issue because the baby, we believe, is a miracle sent by God, and it's here for a reason and a purpose, and God does not make mistakes. Every life is made in His image and is sacred and must be treated as such. It is a human rights issue. Everyone should have the right to life, and this life should be protected by law. All of us in this room were once a baby in the womb, and we are here now living our lives. We should all be given the same rights. You say it is an equality issue, but in New York, more black babies are killed in abortion than are born. Is that equality? It is exactly what Margaret Sanger, the founder of Planned Parenthood, had in mind when she started Planned Parenthood. She targeted the poor, the minority, the disabled. So this bill does target all those people, along with people who object to abortion for one reason or another. Why is it that we always are funding the abortion industry, federally and statewide, and never proposing funding for life-affirming agencies? Give them a true choice. Give them their dignity back by saying you are strong enough. We love you and your child enough to help you. By building them up and not tearing them down, we can build a culture of life, not death. Sorry.
Thank you. Are there any comments or questions for this witness? All right, seeing none, welcome to the committee. If you want to go ahead with your testimony.
Thank you. My name is Dr. Anna Whelan. I am a board-certified OBGYN and a fellow of the American College of OBGYNs. I am also a maternal fetal medicine subspecialist, which is to say that I specialize in maternal medical care as well as fetal development. Additionally, I'm a survivor of severe preeclampsia in the early third trimester, a mom to a NICU baby, and also a mom to a healthy toddler. The daily reality of my job includes providing bad news, an unplanned pregnancy, a lethal anomaly, and life-threatening maternal medical conditions. I always hold the ethical principle of justice and autonomy in every patient interaction that I have. I counsel them on risks, benefits, and alternatives. This goes for when I'm talking to someone about the need for a cesarean delivery, and this is also talking to patients about their option of having an abortion. What prevents me from providing care with true justice is the laws that are in place, which make my patients have to worry about how they're going to afford their medical care instead of what is best for them and their family. I briefly want to share the story of one of my patients, although this could be any of my patients. This patient I first met at 22 weeks. She came to my ultrasound suite where she was referred for having no fluid on her ultrasound. Her scan confirmed a lethal diagnosis, absent fetal kidneys, a condition which is lethal either during pregnancy or immediately after birth due to failure of the lungs to develop. However, my patient was devastated, and her family made the choice to terminate the pregnancy, to have an abortion. However, she has Medicaid insurance, and she could not afford to go through a termination at 22 weeks, which would cost almost $10,000. Instead, she was forced to continue her pregnancy. She delivered her baby at 31 weeks, and the baby died 2 minutes after birth. People have abortions for many reasons, not just in cases of anomalies, and every single reason is valid. There is no such thing as an elective abortion. There is only abortion. Laws that prohibit insurance coverage of abortion disproportionately affect those who are already at risk for suboptimal health care, for preterm birth, and for maternal medical complications, including increased risk of maternal morbidity. Those who have been systematically devalued in our state and country's history. These are the patients for which the racism embedded in the healthcare system puts their risk of mortality up to 3 to 4 times that of their white counterparts. In our capitalist society, one of the ways to move toward equitable care is by removing financial barriers to care. If we want to truly improve healthcare in our state, we need to remove these barriers, such as limitations on state and Medicaid funds. Thank you for supporting the Equality and Abortion Coverage Act, S32.
Thank you. Are there any comments or questions for this witness? Senator DeLuca.
I just have one question. Do you believe that baby that was only alive for 2 minutes had the right to life?
I believe the patient had the right to make make a decision for herself and her family.
Leader Dela Cruz.
Thank you so much, Chair. I heard your testimony, and thank you very much for it. You know, it takes a lot for people to come and testify because they're busy, they have kids, they have jobs, and so I appreciate that very much, even though I don't agree with you. But you had mentioned that the law is prohibitive. Can you tell me which law prevents abortions?
You can prevent abortions in many ways, and one of the biggest ways is financially preventing them. So it can be legal for a patient to receive an abortion, but if they are unable to because they cannot afford it, then it is something they can't do.
Yeah. So the answer is there is no law to prevent abortions because in the state of Rhode Island, in 2019, we passed a law that allows for abortion in any trimester, any month. So the answer is no. And if
I think you're incorrect.
I'm not finished. Thank you, though. So it's not illegal to obtain an abortion, but it's also not fair to have taxpayers pay for someone's elective procedure. Now, if it's life of the mother, incest and rape, we already cover that, and we have for many, many, many years. But so I just want to make sure that everybody who's listening understands there is no law to prevent abortion. Thank you very much. Yeah. No question.
I actually would like to respond to that because I think that you are incorrect. One, you cannot have a termination at any age, and two, no, you cannot.
Yes, you can.
You do not have a say in what happens in my exam room and my patients. We ultimately have to give them the autonomy and justice to allow them to make decisions for themselves and their families, and you are not allowing that if you do not fund abortion.
Thank you,
Well,
Doctor.
women have the autonomy to do that in all 9 months.
Are there any other comments or questions for this witness? All right, thank you. Welcome to the committee.
Thank you, Chairman Yor and members of the committee tonight. My name is Dr. Beth Cronin. I'm here today as the Rhode Island Section Chair for the American College of Obstetrics and Gynecology. I'm here in strong support, as Dr. Whalen just spoke, of Senate Bill 32, and I'm going to speak in strong opposition to the other remaining Senate bills that you've heard about this evening. The Rhode Island section of ACOG represents 140 physicians and partners who provide comprehensive reproductive health care in our state. We are a leading authority in obstetric and gynecologic health care and are committed to public policy based on facts and evidence-based medicine. Abortion is an essential component of health care. Like all medical matters, decisions regarding reproductive health care, including abortion care, need to be made by patients in consultation with their clinicians and without undue interference by outside parties. As mentioned, the Equality in Abortion Coverage Act will treat all Rhode Islanders equally. This will add coverage for abortion on our state Medicaid program, ensuring that everybody can access the same standard of care. ACOG affirms that public and private insurance coverage of abortion care should be considered as part of essential healthcare services and not singled out for exclusion or additional administrative or financial burdens. Additionally, ACOG strongly opposes any governmental interference that threatens communication. I believe that we all deserve to enter our doctor's offices with the assurance that the options for care we receive will be based on scientific research and experience, not a political mandate from the State House. This is why you must vote against Bills 298, 347, 392, and 397. The politicians introducing and supporting these bills have one goal: to attack our rights and freedoms. These bills are unnecessary, intended to be inflammatory, with really all I can see is they are to try to criminalize access to medical care and limit the access to abortion. Medical guidelines and ethics already compel us to, in the setting of life-threatening circumstances, for our patients to respond. We are already bound by this. These bills are vague, they are poorly drafted, and could criminalize doctors who are helping individuals in complex and tragic circumstances. Some of these bills would make us pause, delay care, and potentially lead to loss of life. These bills outline theoretical scenarios that are very far-fetched and could create a chilling effect across the state and limit access to safe legal abortion. Senate Bills 392 and 347 contain very vague language that, even understanding their presentation and reading through these bills, as a supervising attending physician practicing medicine in this state for the last 17 years, I don't truly understand what I'm supposed to do if these were passed. Senate Bill 397 is written to spread misinformation about healthcare. It's to create confusion and limit this access. This extreme ban, but it is written to sound like we should just limit abortions after 20 weeks. This is going to have chilling effects across the state.
Thank you.
Thank you very much.
Are there any comments or questions for this witness? All right, I don't see any. Thank you so much. Next up, we have Dr. Andrea Arena, Jean McDonald, and Diane Santinello. Welcome to the committee. We'll start in the middle of the table. If you want to go ahead, introduce yourself.
My name is Jean McDonald, and I'm here as a private citizen, testifying in strong opposition to 32 and Sub A. Rhode Islanders, this would force your fellow Rhode Islanders to be complicit in abortion against their will. This is an egregious overreach of state authority, as well as a severe threat to religious liberty. You would force Rhode Islanders to fund actions that are contrary to their principles and to the practice of their faith. Forcing every Rhode Island taxpayer to fund elective abortions and forcing employers to violate the tenets of their faith is that egregious overstepping of authority and a serious attack on religious liberty. Catholics and people of other faiths, as well as those who recognize the humanity of the unborn because of the scientific fact that human life begins at the moment of conception, should not be forced to violate their faith practice or their principles by being forced to fund abortion. Practicing the faith for Catholics means that they are not allowed to perform an abortion, They're not allowed to procure an abortion. And we're also not allowed to provide material assistance for abortion. Paying for abortion is material assistance. Passing this bill will disenfranchise the religious liberty of anyone who's attempting to be a practicing loyal Catholic. It is an egregious assault on religious liberty and in violation of the tenets of our faith. I would also like to point out that many pro-choice proponents have often labeled themselves as pro-choice and held that individuals have a right to choose. Well, where is the choice for pro-life Rhode Islanders if the state enacts laws or budgets that force every taxpayer to support and fund abortion against their will, either paying directly for procedures of abortion or for the health insurance coverages that make it possible? And I ask each one of you, do you believe that medical professionals have the right to choose not to perform or assist in an abortion procedure? Do they have a choice? If you think that they do, then why would you not also recognize the right of your fellow Rhode Islanders, non-medical Rhode Islanders, to exercise their right to choose not to be forced into supporting and paying for abortion against their principles and the tenets of their faith? If you think that medical professionals and all others should be required to perform or pay for abortions against their will, then you should admit that to you, choice is a fiction and a facade, and that those who disagree with you have no option or choice, because that's what this legislation would do. The fact that, sadly, elective abortion is recognized as legal does not compel the state or its taxpayers to provide funding for it. Let's be clear. The removal of an ectopic pregnancy or cancer treatment during pregnancy are not elective abortions. The vast majority of abortions are not due to medical conditions. Pregnancy is not a disease, and an abortion is not a medical treatment, an elective abortion. Gambling is legal in the state, but the state doesn't have the right to make me buy lottery tickets for my neighbor.
Thank you, Ms. McDonald. If you have I'm sorry, you ran out of time, but if you have additional written testimony, you can please provide it to the committee.
Well, I'd just like to add that this historical, the Quakers during World War II, when the military draft was in place, they had the option of alternate service because of recognition of the pacifism of their faith, nonviolence. They were allowed to do non-combat service. If you're going to pass something like this, then you make a carve-out so that every loyal Rhode Islander, in principle or by faith, who will refuse to violate their faith, get an instead of paying taxes, will pay to funds.
Ms. McDonald, I'm going to have to cut you short. I'm sorry, you ran over time, okay? Thank you. Because we've got 100 people here tonight. If I allow that to happen, everybody's going to do that. Thank you. Dr. Arena, welcome to the committee.
Hi, thanks for the opportunity to speak. My name is Andrea Arena. I'm here today in my role as a family physician and a Rhode Island resident and a Catholic. I've been caring for families for nearly 30 years and here in Rhode Island for more than half that time. I provide abortions, both medication and procedural abortions, for my patients as part of my primary care practice. I'm here to express my strong support of SB 32, the Equality Abortion Coverage Act, and I'm strongly against Senate Bills 298, 397, 347, and 392, bills that are without factual evidence-based merit. I want to point out Black women living in the United States and in Rhode Island have worse health outcomes, and particularly worse maternal health outcomes. Why does this matter? In 2021, more than 40% of people who identified as Black were covered by Medicaid, just 17% of white people. Passing SB 32 is a racial justice issue which would remove disparities perpetuated by existing barriers to care. Denying coverage for abortions to patients with Medicaid coverage means delaying their care. Patients covered by Medicaid or state insurance are left to raise money to pay for their medications or their procedure. The cost for an early abortion in Rhode Island, whether procedural or medication, is between $600 or $750, well above that for later procedures. And financial barriers are one of the main reasons people end up seeking abortions later in pregnancy. Patients who come to my clinic will receive thoughtful, evidence-based care, but for those seeking an abortion, most of our time will be spent working out how to help them find ways to pay for it, because most of our patients don't have private health insurance. This, again, will delay care and restrict their options between medication and procedural abortions. I would also like to speak to the concern about Catholics in districts and where their tax dollars are going. I was raised in a Catholic family. I was baptized and confirmed in the Catholic Church. I went to Catholic school. I married in the Catholic Church, and both of my children were baptized in the Catholic Church. What I learned from being a Catholic is to fight for justice and against oppression, and to treat every single person with dignity and respect. More than half of U.S. Catholics, 56% polled, say abortion should be legal in all or most cases. And of course, they have abortions themselves. In 2014, a quarter of patients who presented for abortions identified as Catholics. 53% of Catholics in Rhode Island polled in the summer of 22 supported this legislation, the Equality and Abortion Coverage Act. Rhode Island has already protected access to abortion in our state with the passage of the Reproductive Privacy Act, and yet we continue to uphold a barrier just to those who have worse health outcomes and fewer resources. Deciding whether to have an abortion is a personal decision made by thoughtful people who know what is at stake in their lives and when they decided what is best for them and their families. It should not be decided by me as their physician, and it should not be decided by legislative bans and restrictions, nor restricted to only those who have the means to pay.
Doctor, thank you. Does anyone have any questions for the doctor? Senator Lamont.
Thank you. Good afternoon, doctor. Just wanted to ask a clarifying question. In your practice, have you had real-world experience with people having financial constraints, depriving them access to a healthcare decision? I know you referenced
yes,
it in your.
I had a busy clinic today, and I did not want to rush through and come here tonight. And the reason I'm here is because every week in my clinic, this is what we deal with, is meeting patients who are having trouble getting the care they need because of financial barriers because they have Medicaid.
And by allowing, this bill would remove that barrier and put people on equal footing. Would that allow, it would just take away the financial constraints from that situation and give them access to health care that people on private insurance have. Is that correct?
That's right, and it would prevent delays in their care as well.
Or to make sure that everybody that you treated in your facility were on equal footing. Is that correct?
Yes, avoid the stigma, having to come back to the clinic, have to, have multiple visits to the clinic, which is another financial barrier.
Thank you. No other questions.
Thank you. Any other questions for the doctor? Leader De La Cruz.
Thank you, Chairman. So when we talk about equal footing, women in this state have the equal opportunity to procure an abortion if they so wish, correct?
No.
So the
No, that's
issue
not
here,
correct.
the issue here is whether or not Rhode Islanders should be paying for abortions that are not medically necessary. I appreciate that you're Catholic. I'm not a Catholic, but I appreciate that you are. There'll be Catholics here in support and of the legislation, and many against the legislation. But I'm not looking at it through a religious lens. I'm looking at it as what's fair for the taxpayer. Should they have to pay for every procedure that one might need? If I need a medical procedure, my insurance doesn't cover every procedure that I might need. And so most Rhode Islanders that I talk to across the state are against funding abortion outside of rape, incest, life of the mother. And I think we need to listen to those Rhode Islanders. Thank you.
May I respond?
Well, there wasn't a question, doctor. It was really a statement, but I'll give you an opportunity.
Just a minute, just to say that in medicine, we need to look at the evidence. So I talk to lots of people who, for example, I see a lot of 30-year-olds who have breast cancer, but I don't make my decisions based on what I see and who I talk to. And I think when we're talking about what do most Rhode Islanders want, we have to look at the polls and the data rather than sort of the folks that we're just speaking to.
Thank you, doctor. Any other questions for the doctor? Leader De La Cruz.
Yeah, so polls and data, so we'll go to that. What's happened is, and I got to give credit where credit is due, the proponents of the EACA have misled the public to believe that we don't already provide abortion for women who are employed by the state or receive Medicaid, or are covered by Medicaid. Most of the people that I talk to are shocked to find out that we already provide taxpayer-funded abortion. And when I tell them that what this bill aims to do is to expand it beyond that, they are very unhappy and displeased and very much against this legislation. Because I talk to people in my district, and I've gotten emails from people in my district, and the overwhelming disapproval for this legislation is really phenomenal. I mean, it's remarkable. Thank you.
Okay, we're going far afield on the dialogue. Yes, Senator, do you have a question for the doctor?
Yes.
Please proceed.
You're a practicing Catholic, correct?
I'm not sure what you mean by practicing Catholic.
You
but
go
I
to
feel
church
like I
every
have
Sunday.
Catholic
You don't receive the
credentials.
Eucharist unworthily. You go to confession
have-
before you receive the Eucharist. Or
I'm not sure that I need to respond to that question.
okay, I was just
Doesn't
checking.
seem
If
really
you wanted to, I
appropriate the
can inform
situation
you
here.
about examination of conscience, if you were interested about examination of conscience before receiving communion. And it just states, did I, without grave reason, with the intention of avoiding conception, make the use of did I suggest to another person the use of birth control pills or another artificial method of preventing pregnancy? So that's a much smaller thing, but even if you were to do such a thing, you just so you know, you would have to go to confession.
Doctor, you don't have to answer that. I'm going to rule that
Just
question
state,
out.
because
I'm going to
for
rule that
practicing
question out of
Catholics.
order, Senator. Okay. Any other questions for the doctor? Relevant questions to the doctor? Doctor, thank you for your time. Ms. Santianello, welcome to the committee.
Is this on?
Yep.
Can you hear me?
Yep.
Is it up?
Yep.
Okay. Hi, good afternoon, Senators. Thank you for giving me this time to speak. It is a privilege. I'm here today to implore you, to beg you to vote against Senate Bill number 32, which will force taxpayers to pay for abortions. I will say to you what you already know, what everyone in this room already knows, even those who come before you and say otherwise. Abortion is not health care. It is simply not health care. This is a word game designed to try and make acceptable the unacceptable, the abominable. In every abortion, at least one person dies, and the other person, the mother, suffers untold ill effects, both immediately and long term. Abortion is many things. It's destructive, obviously, to the innocent unborn child, destructive to families and to the very notion of families, destructive to women and demeaning to women, as so much of what is happening in our society today is. It is evil, vile, straight from hell, but it is not health care. But let's talk about rights. Obviously, in abortion, the rights of the unborn child, well, there are none. The child is simply not even considered. But what about me? What about my rights? What are my rights? I'm a fully born, fully grown woman who has been paying taxes for over half a century. And we've all been taught that we have rights, but they are not without limits. I believe, as do so many Rhode Islanders, that abortion is evil and reprehensible. A woman's right to terminate her pregnancy cannot, must not infringe on my right to follow my religious beliefs. My faith, my conscience, does not allow me to participate or condone the evil of abortion, and this group, you senators, have the power to protect my rights. I have rights too, and they are just as important as anyone else's. We, the taxpayers, are already paying for abortions due to rape, incest, and life of the mother. That's enough. In addition, I ask you to support Senate Bill 298, which requires healthcare facilities that perform abortions to meet license requirements of similar healthcare facilities. If we need a law to make this happen, that means it's not already happening, which further proves that abortion is not health care. Please also support Senate Bills 347, 392, and 397. At this moment in time, unborn children in the state of Rhode Island have no other defender but you, senators. Thank you.
Thank you. Any questions for Ms. Santinello? Thank you being done. Thank you so much. The next group that we have is Michelle Moreno Silva, Claude LaBeouf, and Tammy Brown. We'll start on my right and your left. Welcome to the committee.
Good afternoon, members of the Judiciary Committee. My name is Michelle Moreno Silva. I'm the Communications Director for Treasurer James Diosa and appear before you as his representative to testify in strong support of Senate Bill 32. Treasurer Diosa asked me to testify on his behalf as someone directly impacted by this legislation. I am a woman of color employed by the state and enrolled in the state's health care plan. In 2019, the General Assembly had the foresight and the social and political cognizance to protect a person's right to abortion. And when the Supreme Court made the unprecedented decision to overturn 50 years of precedent to the right to an abortion, that remained relatively unchanged in Rhode Island. However, the law first passed in 2019 is incomplete, for it does not allow Medicaid recipients and state employees, myself included, to use health care coverage for most abortion-related procedures. Rhode Island remains only one of 2 states in New England to prohibit the use of Medicaid funds for an abortion. By its own language, the Reproductive Privacy Act is intended to promote equity. This bill will help achieve that legislative purpose. The current statutory restraints disproportionately impact those most in need of financial assistance, the poorest in our state, who are most often families of color living in neighborhoods like those where the treasurer and I grew up in Central Falls. Without health care coverage, many may be left without the financial means to pay for an abortion, constructively denying them a right our state guarantees by law. Without the ability to afford an abortion, the right is little more than an illusion for some. The House has taken swift action to pass this bill, and now the Senate must do the same. With your vote in support of this legislation, you will send a resounding message that we are committed to reproductive justice and that the right to reproductive health is fully realized for all people in the Ocean State. Thank you.
Thank you. Any questions for this witness? There being none, Mr. LaBeouf, welcome to the committee.
Thank you. My name's Claude LaBeouf. Can you hear me? I can't tell.
As long as the button is up, sir.
Yeah,
Button up to speak?
it's up. I can see
Is it
it's up.
okay?
Yeah.
Okay. I can't tell if I'm not hearing an echo. Okay, anyway, so my name is Claude LaBeouf. I'm a group leader, a support group leader for an organization, a group called SNAP, which stands for Survivors Network Abused by Priests. All the people in my group, myself included, were victims of sexual violence of Catholic clergymen as children. So I'm here as an ally with pro-choice and Planned Parenthood. I hear a lot of medical testimony. That's where I go, is by reading and listening to medical people. It's not my area of expertise. I hear support on both sides. So I'm here to support elective abortions being funded by the state of Rhode Island. And I'm considering, I've heard a lot of people from the Catholic diocese make some very judgmental calls here, philosophical calls about the sanctity of life. So I'm going to make my philosophical point, being that I'm not a medical person, that the sanctity of life is talked about theoretical lives, future lives. People like me, I was 8 years old. I was sodomized by a Catholic priest in the state of Massachusetts. I was alive. Nobody cared about the sanctity of my life. In March, I testified about repealing the statute of limitations in Rhode Island for sex abuse crimes. My rationale is that spirits were murdered. People talk about unborn children's rights, all kinds of philosophical points that really don't mean much to me, because the fact is the Catholic diocese continues now with all its moralizing to not care about the real lives. 8-year-old kids, 9-year-old kids being sodomized and raped. So I hear these arguments. I feel very deeply offended by that. So that is my input. I'm supporting Planned Parenthood, pro-choice, because I believe there are many reasons where an abortion, what's considered an elective abortion, needs to be funded. I hear support from medical people. It's not my area, like I say, but I'm going to go with that, and I believe very strongly what I've said. I'm a strong supporter of pro-choice Planned Parenthood.
Thank you for your testimony. Any questions? Thank you. Ms. Brown, welcome to the committee.
Thank you. Good evening, members of the committee. My name is Tammy Brown. I'm a lifelong Rhode Islander, a decades-long voter, and a concerned citizen. I'm also on the board of the Woman Project Education Fund, and I'm here to testify in strong support of the Equality in Abortion Coverage Act. In 2019, we as advocates and the Rhode Island populace at large fought hard to codify the ability to access abortion into Rhode Island state law. This policy was vitally important as a matter of reproductive justice and human dignity, and it was widely supported by the elected officials in the Rhode Island Senate, as well as a wide majority of the Rhode Island public. The passage of that bill was an acknowledgement that the right to determine your own destiny when it comes to when and if you want to become a parent is a central aspect of what it means to be entitled to life, liberty, and the pursuit of happiness, and to be a full participant in our society. While we're proud of the work we did then to secure the right to safe abortion in the state of Rhode Island, across the country, the ability to access abortion care has been limited or eliminated for millions of Americans. And here in Rhode Island, we know the right still isn't real for tens of thousands of Rhode Islanders who are covered by Medicaid and state employee health insurance. Safe, affordable access to abortion should have no bearing on your financial means or where you work. Low-income people and the people who work hard every day to keep our state running should not be denied access to basic and vital reproductive care. We should not create a two-tiered system where some folks have access to care and others don't. And let's be real, we know that the burden of abortion coverage bans falls hardest on low-income women and women of color. In a free and just society, we must not let politics stand in the way of health and human dignity. The EACA upholds the values of justice, equity, and non-discriminatory access to health care. It is not the role of the legislature or the government to make health care decisions of individuals. And it's not the role of the individual taxpayer to treat the tax code as an a la carte buffet, choosing where they spend their money and what they don't spend it on. With all due respect, the times for political games are over. It's time to stop playing politics with our bodies. We fought hard to make strides toward reproductive justice in 2019, and we will not stop fighting until that right is real for all Rhode Islanders. We know this bill has strong support in both chambers. It just passed the House. But Rhode Islanders don't have time to wait. For every month that goes by without the passage of the EACA, more Rhode Islanders will be put in the perilous position of choosing between having enough food or paying their rent on time and vital reproductive care. We will keep showing up both here and at the polls to make sure we secure the right to safe and affordable health care for everyone. Thank you.
Mr. Chairman, I don't have a question, but I do need to state if we're having individuals come before committee to ask us to change the law based on their testimony. And when the testimony is inaccurate or false, then I feel that I must point it out. Ms. Brown, you mentioned that, that Rhode Islanders are denied access. Not true. Abortion is legal.
I think that's your opinion on what access means. I don't know that it's fair.
I apologize, but to the extent that there's a question being asked, we'll give you an opportunity to answer. If it's a statement, then each senator has that prerogative to do that, okay? Thank you.
Thank you, Mr. Chairman. So women are not denied access to abortions in Rhode Island.
That is untrue.
And you also stated some folks have access and some don't. Also not true. Access is available to all women.
You don't have access if you can't afford to pay for it.
Ma'am, I have to insist.
Okay, I understand.
She has a right. I understand it's a polarizing issue, but she has a right to say something. And she's not asking you a question. I'm going to ask you to please refrain from
I will also say that it's very...
Thank you.
Also, the last point was that that we prohibit choice and access. Also not true. Thank you, Mr. Chairman.
Thank you. Any questions for Ms. Brown? Yep, Senator Lamountain.
Thank you, Mr. Chairman. You brought up a good point. The RPA guarantees the right to abortion in Rhode Island, and that right cannot be infringed. So let me ask you, what's the purpose of having the RPA if people can't have access to it? It seems not to make any sense to me. What's your sense on that?
I don't believe that the right is real until it's real for all Rhode Islanders, including Rhode Islanders who can't afford to pay out of pocket or who don't have private insurance.
Any other?
Yeah, Mr. Chairman.
Leader Dela Cruz.
Thank you. Again, because accuracy is important.
That didn't seem to be the case for the prior person that testified.
I apologize. It all balances out. Senator LaMountain asked you the question. You were able to speak. Please.
It's very intimidating for folks who are
I
here from the
understand that. I
public
understand
to
that.
be grilled
Please,
by a senator when she's just trying to make a point.
Yep. I'm not going to argue with you. I insist that you're going to stop now. If there's a question asked, we're going to play fair with everybody, okay? Thank you.
Thank you, Mr. Chairman. If someone's coming before the committee in their official capacity for an organization, they can expect questions. I'll point to the Rhode Island Constitution.
I would like a question then.
And Article 1 and Section 2. And it says here, laws for the good of the whole, burdens to be equally distributed, due process, equal protection, discrimination, no right to abortion granted. The very last line of that Section 2 says, nothing in this section shall be construed to grant or secure any right relating to abortion or the funding thereof. So just leaving that there, Constitution of Rhode Island. And
Is that a
again,
question?
Women do have access in all 9 months.
Thank you,
Mr.
Leader.
Chairman.
And this concludes this witness. The next three witnesses we have are Honor Ford, Leanne Hood, and Nicole Jelinek, and I apologize if I mixed up your name. Are any of those folks here? Joe, are any of those folks in the hallway? That is Honor Ford, Leanne Hood, and Nicole Jelinek. Only one? Your name, ma'am? Nicole Jelinek. Okay. So we're going to move on to the Reverend Jean Disluski and the Reverend Wendy Van Orken. Oh, I apologize. We got you in the holding pattern, Reverend, okay? Thank you. That's what happens when you don't look up. Okay. So we'll start on my right. Welcome to the committee.
Thank you. Thank you to all the members of the Senate Judiciary Committee and the chair. I'm Nicole Jelinek. I'm the chair of the Rhode Island Coalition for Reproductive Freedom. I'm here to testify in strong support of Bill 32 and opposed to 298, 347, 392, and 397. Our coalition thanks you for your support of the Reproductive Privacy Act in 2019. And we see the consequences of other states not doing the same all across the United States as abortion has become illegal. We are here today to talk about the gaps left by the RPA, the nearly 1/3 of Rhode Islanders whose health insurance doesn't cover abortion. Consider Jane, a 31-year-old single mother of 3 children, working full-time at a donut shop, so starting each morning at 4:30 in the morning, 5 days a week, relying on extended family to get her eldest 2 children off to school each day, and to provide for daycare for her youngest child, not yet school age. She takes 1 class at a time at community college to get her degree. She becomes pregnant unintentionally, although she's using birth control. Her insurance, Medicaid, won't cover abortion. She must borrow money from family or friends, or tap into funds from the Women's Health and Education Fund in order to access her health care. Then I'd like you to consider Sue, a 31-year-old married mother of 3 children, the same ages. Her husband gets insurance for their family from his employer. She works part-time as a bookkeeper from home and is able to work around the hours that her children are at home. She also becomes pregnant unintentionally while using birth control. She is able, in consultation with her husband and her doctor, to use her private insurance to cover her abortion. She does not need to tell anyone or wonder how to afford it. And this is what this is about. It's about private insurance versus public insurance. It's about inequality and lack of access. 72% of Rhode Islanders believe that people should have the same health benefits regardless of whether they have public or private health insurance. Full stop. Our coalition began in the 1980s as the 2-to-1 coalition after a proposed state constitutional amendment to ban abortion on the ballot in 1986 was voted down by 2-to-1. This coalition provided a means to harness the power of many voices to demand change and seek true reproductive freedom. Today, coming up on 40 years after that vote, we continue to need to exist as our work isn't done. We continue to work to actually realize legal rights and make them accessible for all. Thank you.
Thank you. Any questions from Ms. Jelinek? There being none, we'll take Leanne Hood next.
Hello, my name
Welcome. I'm sorry. Welcome to the committee.
Thank you very much. It's a privilege and honor to be here. So my name is Leanne Hood. I am a rare disease and disability patient advocate for the state of Rhode Island. I am a volunteer with the Every Life Foundation and have championed Rare Disease Week and Rare Across America as the Rhode Island state representative for the last 3 years. I speak to you not only as an advocate, but also as a patient who lives with rare diseases and physical disabilities. As an advocate, I represent 65 million Americans who live with a disability and between 25 and 30 million Americans who live with a rare disease. These stats are published by the CDC as well as raredisease.org. I feel rare disease patients are not being included in the conversations with abortion rights. In all the interviews I've watched and the articles I've read, not once have I witnessed mention of rare disease patients or patients that live with disabilities in these conversations. No one is considering our perspective in the creation of these laws. For us patients, this is often a matter of life and death. Who can have an abortion and who can't? Who has an exception for an abortion and who doesn't? Medicaid and Medicare patients do not have access to abortions as they are listed as an elected procedure. As an example, Ehlers-Danlos syndrome is a genetic condition with faulty connective tissue and has a much higher risk of placenta abruption, miscarriages, and hemorrhages. A woman can bleed out in a matter of minutes if not attended to immediately by medical personnel. SUDEP is a genetic mutation that causes sudden death by epilepsy with no warning. Multiple sclerosis is a degenerative demyelination of the nerve cells in the brain and spine. My medical conditions are not a desirable condition that I wish to pass off to my offspring. Knowing my risk factors during pregnancy, I chose to have a hysterectomy at the age of 37. I was blessed to have private health insurance that covered this elective procedure. Many do not have this, including state and federal health insurance. In fear of becoming pregnant and not having access to abortion, members of the rare disease community and patients that have disabilities are choosing to castrate themselves. We should never have come to this. Often discussions with hospital lawyers are had to avoid any liability and loss of medical licensing. OBGYN physicians are leaving states that have strict abortion bans in fear of their licenses. Rare disease patients and patients with disabilities need these providers. These life-saving procedures are sometimes successful and sometimes they are not.
I'm going to ask you to finish up. Your time is okay.
Thank you. Often it is a patient who bears the full impact of delayed care. Sometimes patients are not able to conceive later on and sometimes even losing their life. I conclude this speech by again thanking the Senate Judiciary Committee for allowing me to speak and represent the rare disease and disabled community. Thank you.
Thank you so much. Any questions for this witness? Thank you. Honor Ford, and I apologize if I butchered your first name.
Yeah, you pronounced it correctly. Thank you. My name is Honor, and as you notice, I don't have a pretty speech in front of me. I got the phone call today at 4:30 from my friend Leanne to let us know what was happening here today. And I am here as a citizen hoping that you all will support the expansion of access to abortion to folks. I know there's been some discussion about this idea that it is very accessible to everybody now, so there's nothing that needs to be done. And that isn't true, because I think, hopefully you all know, there's quite a crisis going on right now in Rhode Island with affordable housing, with food insecurity, amongst other things. Let me add on, with people that are going to get kicked off of Medicaid because of the COVID emergency coming to a close. I am here today as a person that was very concerned that abortion access was going to be restricted in 2016, and when Trump was elected, that was confirmed as he put people into positions of power that reversed Roe v. Wade. I made the choice to have an elective sterilization done so that I would know that I would never become pregnant. So that was covered by my Medicaid. I was really fortunate that I was able to secure the procedure because I had a doctor that supported me through Planned Parenthood that respected my right to make this choice. So I just want to really reiterate this idea that it is accessible to everyone is not true, because if you cannot afford to pay for the abortion, you cannot have the abortion. My hope is that these people in power here will support people having abortions that can't afford them, so that they are not forced to bring children into this world that they cannot afford to support. I am very lucky in the sense that I have a bachelor's degree. I have a support system of people that care about me. I live in a 2-bachelor household right now, and we're literally converting our 1-bedroom household into 2 bedrooms because we don't know how we're going to afford our rent that has been increased. So this idea that things are accessible to everybody is not true. We are all facing so many issues right now with accessibility to basic needs. And quite frankly, if people don't want to have children, they shouldn't have kids. They shouldn't be forced to do that. And that shouldn't be forced upon poor women. So I am just here in the hopes that you all will support expanded access to abortion for everyone.
Thank you so much. Any questions for this witness? There being none, let's try this again. The next witnesses are the Jean Disluski, the Reverend Wendy Van Orken, and Diane Barentz. Joe, can we try and find the Reverend Wendy Van Orken and Diane Barentz? Okay, with that, so we'll move on then to join the Reverend Susan Killenberg and Claire Chenning. Well, I know. Okay. Ma'am, your name, please?
Diane Behrens.
Okay. And why don't we call up Lynette Labinger? I know Lynette's here. Reverend Jean, welcome to the committee.
Well, thank you. Thank you for having me. I'm Gene Dishlevsky. I am the chair of the Rhode Island Coalition for Reproductive Freedom. I'm also the president of the Rhode Island State Council of Churches. And I'm going to be brief because I don't want to repeat the testimony, a written testimony that I have submitted. As a matter of fact, if I could ask the clerk to be kind enough, I brought a booklet with written testimonies from a dozen clergy and religious leaders from various faith groups in Rhode Island. And I encourage you at your leisure, when you have time, to read the testimonies. I may have saved you from listening to 12 preachers tonight.
I suspect we have about 150 preachers tonight, but that's...
I encourage passage of the Equality in Abortion Coverage Act. Basically, it is an opportunity for you to make an adjustment in what I see as systemic inequality. It is frustrating and sometimes heartbreaking to do pastoral care with a family that doesn't have adequate insurance coverage. And families should have an opportunity to make prudential choices about how many children to have, when to have children, or if to have children. And so by passing this bill, you make this kind of health care available to more people. Thank you.
Thank you. Any questions for Reverend Jean Disluski? None. There being none. Thank you, Reverend. Diane, welcome to the committee.
Is that it? On? Am I on? You are. Okay. Thanks for the opportunity. My name is Diane Behrens. I live in Barrington, and I'm testifying on behalf of Hope and Change for Haiti as a member of its executive board and on behalf of the 2/3 of Rhode Islanders who support passing the EACA. In 1968, when I was a 19-year-old sophomore at the University of Texas, I had an illegal abortion in Mexico. I vowed that I would not back down from the struggle until safe, legal, accessible abortion was a healthcare reality for everyone in this country. So I ended up on the front lines of the fight to pass the Reproductive Privacy Act in 2019. When the RPA became law, I felt relieved but not triumphant. I mean, let's be honest, I'm a relatively privileged white woman. But Rhode Island law continues to prohibit more than 85,000 childbearing age Rhode Islanders from using their health insurance to cover abortion. These restrictions impact people of color and people with low incomes the hardest. As a Rhode Island-based organization that advocates for women and immigrant rights, Hope and Change for Haiti is all too aware of these facts. The organization knows that having a legal right to abortion care doesn't mean having access to abortion care if one can't afford to pay for it. As a child, I was taught that every person in the United States had a right to life, liberty, and the pursuit of happiness. But growing up in the U.S. in the 50s and early 60s, I had my doubts. Over time, however, with the passage of legislation such as the Civil Rights Act and the Voting Rights Act, I allowed myself a measure of hope. Then, with the 73 Roe v. Wade decision, I felt that something transformative had happened. Finally, it seemed that the more than 50% of the population who potentially bear children were recognized as being trustworthy enough to make profoundly personal decisions about their bodies and their futures. It looked as though we were finally being deemed full-fledged people, that we had the right to life, liberty, and the pursuit of happiness. But then ensued the backlash, initially manageable, though debilitating, but increasingly relentless and eventually triumphant. On June 24, we were put in our place. No longer were we able to decide for ourselves our reproductive futures. Those were going to be decided for us. Whether or not you personally support abortion is none of my business. I simply ask that you make it possible for people, yes, people, to realize their own reproductive futures by making those futures economically accessible. Hope and Change for Haiti and the overwhelming majority of Rhode Islanders support the EACA. Please vote to bring it to the floor for a vote. Thank you very much.
Thank you for your testimony. Any questions for this witness? Lita Dela Cruz.
Again, Mr. Chairman, some of the statements by the representative for this organization, again, misleading. Rhode Island does not continue to prohibit Rhode Islanders from using their health care for
We've already
abortion.
talked about that.
It is currently...
I don't know if you were in the room when I mentioned, this is not a give and take.
Okay.
The senator has a question, then I'll yield to you. Okay, thank you.
Over and over.
Thank you, Mr. Chairman. So I'm hoping that the individuals who are going to come before the committee and testify that, you know, they properly state these issues here. Having the right versus access, you know, here's the thing. I sympathize with individuals who cannot afford certain medical procedures. As a young woman without health insurance, I found myself in the hospital. I was ill and didn't have health insurance. And it was a very expensive hospital bill. I had to stay for several days. And, you know, I'm a student, very low paying job. I went on a payment plan and made it possible to make it right with the hospital. So there are ways, uncomfortable ways, but there are ways. Thank you.
Thank you, Lita. Any other questions for this witness? Thank you. Lynette, welcome to the committee.
Good evening. I expect that you're going to give me the hook before I finish my remarks, and I apologize if I stop in mid-sentence, but I know it's a long night, so I'll try to get through this. My name is Lynette Labinger. I'm here to present testimony on behalf of the ACLU of Rhode Island in opposition to 4 bills, 298, 347, 392, and 397, each of which is designed to undermine or nullify the Reproductive Privacy Act of 2019. To evaluate them, it's important to understand what the Rhode Island law currently permits and what is already prohibited. The RPA, which was passed in 2019 after careful review and several revisions, codified into the laws of Rhode Island the standards as they then existed, which was to protect personal reproductive choice as then mandated by the Supreme Court cases, which are generically known as the Roe versus Wade protections, in correct anticipation that the new conservative majority of the Supreme Court would roll them back. And indeed they did. They wiped them out at the federal level in Dobbs last June. Following Roe, the RPA prohibits government agencies from interfering with individuals in making decisions to commence, continue, or terminate a pregnancy prior to fetal viability. At the point of fetal viability, the RPA restricts the individual's decision to terminate a pregnancy, except when termination is necessary to preserve the health or life of that individual. To ensure that the Roe status quo was fully preserved, the RPA also formally repealed laws still technically on the books that had long ago been declared unconstitutional and unenforceable. But at the same time, the RPA preserved the status quo as to other laws that, such as Rhode Island's statute, which mandates care of babies born alive during attempted abortion, which is Section 11-9-18. That was not affected or undermined by the passage of the RPA. It's still on the books. It imposes serious criminal penalties up to manslaughter if medical professionals withhold reasonable medical care and treatment to an infant born alive. Now, Senate Bills 392 and 347 both cover the same exact territory and would be an unnecessary duplication of the existing statute 11-9-18, which already makes it a crime to fail to provide care for babies born alive during attempted abortion. But each of those bills is designed to do much more by criminalizing medical procedures and termination decisions that go beyond that and that are protected by the RPA. Each would effectively ban termination of a pregnancy at any gestational age. They do not focus on the point of viability. And since they say nothing about viability, they also disregard consideration of life or health of the pregnant patient.
Lynette, if I can bother you just to
Yeah.
finish up, please.
Okay. The Pain Culpable Unborn Child Protection Act would also interfere with the viability standpoint and reset the prohibition to a much earlier date and apply a new standard of prohibition that provides far more limited exceptions than the life or health of the pregnant person and would be limited to narrowly defined medical emergencies. We've seen how that runs in other states where women have been denied care and told to go home and risk sepsis, hysterectomies, death, because they weren't far enough along in the medical emergency. So I would, on behalf of the ACLU, urge this committee to reject all four of those bills. Thank you.
Thank you. Are there any questions or comments? Senator McKinney.
Thank you, Madam Chair. Lynette, I'm aware of your knowledge in this area, so please help me understand if I can. But if I am correct, our present state law effectively has the government, the state government, precluding state workers and poor people from having the same insurance coverage as everyone else. Is that correct?
It is, and I was technically not speaking on it, but since you're giving me the time to do so, I'm very happy to say that the ACLU supports passage of, I guess it's 32. And this has been an issue for decades. In fact, I litigated the case challenging the exclusion of state workers, and municipal workers, was successful on municipal workers but could not include state workers. It's been an inequity for decades. It serves no financial interest to the state because it carves out coverage that wouldn't cost any more money and treats state workers and their dependents as second-class citizens that can't get the coverage, and for Medicaid recipients, as other speakers have spoken to eloquently, denies them meaningful access. I would just say that when, in 2019, the goal was to reproduce at the state level where we were and not a step further in any direction. And the sad part of that is that we could not push the equity in abortion coverage over the line because the goal was to keep things just exactly the same in anticipation that bad things were coming from the U.S. Supreme Court, which they did.
Madam Chair, if I may follow up. You have some knowledge, I know, as to medical insurance coverage. Are you aware of instances where medical insurers are precluded from providing coverage for any other procedures that are legal in the state?
Well, I am not an expert on insurance law, but I'm not aware of any. I mean, this is a state statute, at least for state employees, that mandates that it not be provided, that it prohibits the state insurers from providing it as part of the ordinary coverage, and requires that it be by, I think, a separate rider, which no one provides because it's astronomically expensive to do that.
But otherwise, this coverage is routine in medical insurance policies.
It would be automatically there.
Let me ask you this, too, because I'm continually hearing references to, I'm not in favor of taxpayer-supported abortions. And my understanding is that the federal courts, I think starting with U.S. versus Lee, and any number of other cases at levels below the U.S. Supreme Court, have ruled that people can't refuse to pay taxes on religious grounds or moral grounds simply because they disagree with particular government policies. Is that correct?
I believe that's the case.
Okay.
Historically, people who are opposed to war, who did not want to support, the military and all of the defense costs, were always unsuccessful in trying to say, I want to withhold X percentage of my taxes because it's going to build up the military.
You can't carve out
No, you can't.
parts of the government that you want to pay for and the ones you don't.
I mean, there have been some fairly prominent actors who were tax objectors who went to jail trying to refuse to pay their taxes.
Well, I'm assuming that every citizen, every taxpayer has personal convictions, political, social, religious, economic, and that if everyone was allowed to refuse to pay taxes for war or corporate welfare or whatever policy they don't agree with, it would be somewhat chaotic.
Indeed, and it would probably encourage people to find a whole bunch more causes because no one likes to pay their taxes.
Right.
Thank you.
Thank you.
Thank you. Are there any more comments or questions for this witness? All right, seeing none, thank you so much. And then I know that Senator Lombardi called a few names. I'm going to try to go back to anyone who we may have missed. Apologies if I called somebody for a second time. Reverend Wendy Van Orken, Susan Killen's Song, Claire Chevins, Barth Bracey. Claire, I believe it's Chevins. It looks like, or wait, Cheung maybe? Okay. Thank you. And do we have Barth Bracey? I saw him earlier. Elizabeth Terry Cantor. Okay. All right, we'll start on my left. If you want to go ahead and introduce yourself, you can go ahead with your testimony.
Good evening. Thank you for the opportunity.
Can you just make sure the button on the microphone is raised?
Is that on?
Try again. There you
Is
go.
that on?
That worked, yeah.
Okay.
Thank you.
Thank you for the opportunity to speak in favor of the Equality in Abortion Coverage Act. My name is Dr. Susan Killenberg. I'm a psychiatrist and a board member for the Women's Fund of Rhode Island. Many here this evening will argue that abortion is essential health care. and I certainly agree. As a psychiatrist, I want to add that abortion is also an essential mental health service. A person's ability to decide when and if to have a child is critical to that person's psychological well-being. Insurance barriers on abortion care can have profound effects on mental health. Approximately 20% of women experience depression or anxiety during pregnancy. These symptoms affect day-to-day functioning, work, relationships, leaving some to decide they feel unable to carry a pregnancy to term. People with PTSD, when faced with a pregnancy, may experience an increase in traumatic memories, flashbacks, and nightmares related to their past trauma, or their pregnancy may tie them to a violent partner in the present. People with chronic eating disorders struggle every day to nourish their bodies. Meeting the nutritional needs of a pregnancy may feel simply impossible. People with substance use disorders have extremely high rates of unintended pregnancies. For some, pregnancy leads to sobriety, but for others, pregnancy is overwhelming, leading to relapse and exposing the fetus to drugs and alcohol. On behalf of those living with mental health challenges, I urge you to remove insurance barriers to abortion care. Insurance barriers on abortion may prevent people from receiving a health service that's critical to their psychological well-being. These bans have the potential to exacerbate the mental health crisis that's already affecting so many young people in our state. Finally, insurance bans on abortion predominantly affect low-income people and people of color. Therefore, these insurance barriers are discriminatory and may contribute to race-based health inequities. Please vote in favor of Senate Bill 32 and remove these insurance barriers to abortion care. Thank you.
Thank you. Are there any comments or questions for this witness? All right, I don't see any. Welcome to the committee. I apologize for messing up your name. If you want to go
That's
ahead and introduce yourself, you can go ahead.
Is it on?
It is.
Okay. Hello, and thank you to the committee and chair for hearing testimony today. My name is Claire Chung, and I'm representing WEF, which is Women's Health and Education Fund, in support of Senate Bill 32 and in opposition of all of the other bills that are against pro-choice. As Rhode Island's only abortion fund, our vision is that abortion and contraceptive care be accessible to all Rhode Island residents, regardless of their economic status or insurance coverage. Right now, 1/3 of Rhode Islanders are left without coverage, either because they're state employees or enrolled in Medicaid. We exist to cover these individuals. Last year, we distributed nearly $74,000 to help fund abortion care in Rhode Island, serving about 500 individuals. Lack of coverage because abortion is excluded from publicly funded insurance is a major reason that patients need to draw from our grants. Additionally, we know that we are not meeting all the needs in the state, and unlike other funds in the Northeast region, we are unable to contribute to what's called solidarity funds for patients in other states who urgently need abortion care and can't afford it. Passing the Equality in Abortion Coverage Act affirms that Rhode Island recognizes the bodily autonomy of every individual. This is especially essential in a national climate that currently condones forced pregnancy. 2/3 of Rhode Island voters support the EACA, and with good reason. Everyone deserves access to essential health care, no matter what. Thank you.
Thank you. Are there any comments or questions for this witness? Senator Takoyan.
Thank you, Madam Chair. You made reference to some statistics or some numbers, and
Yes.
several other witnesses did as well. And hopefully, maybe you can clarify them. They keep using the number 1/3 of Rhode Islanders are not covered.
Not covered, yes.
And my roundabout number is about 1 million Rhode Islanders, so that's about 300,000 people is 1/3 of Rhode Island, correct?
Sounds about right, yes.
But then I hear another number of 80,000 people on Medicare,
Yeah, so it's,
and then another 8,000 state employees. So that tells me it's 88,000. I'm just, what's the 300,000 and the 88,000? If you could just clarify that. When
So
you say
I-
1/3 of Rhode Islanders, many other people have witnesses of stated the same number.
Yes, that number does come from a WEF's poll that we did a few years back, I believe. And it is a third of Rhode Islanders. I'm not sure of the exact number at this time, but I can try to get it for you.
Thank you, Senator. And we'll also follow up with the bill sponsor as well. Are there any other comments or questions for this witness? All right. Welcome to the committee.
Thank you. Thank you for having me. My name is Elizabeth Terry Cantor. I'm a medical student at Brown University, and I am here on behalf of the school's chapter of Medical Students for Choice to express our strong support for S32. Data shows that S32 is both good policy and good politics. It would allow the more than 90,000 Rhode Islanders of reproductive age who are on state-funded insurance to exercise their protected right to an abortion, reducing healthcare disparities between rich and poor Rhode Islanders. S32 is also already immensely popular. According to polling data, over 3/4 of Rhode Island voters support state health plan coverage of abortion services, which is a diverse coalition that includes members of every party and every faith. And I understand that some of your constituents may object to state money being used to fund abortions, but in no other area of medicine does our state allow a minority's personal objections to override definitive scientific consensus and national standards of care. Vaccinations, for example, which can also be contentious, are both covered by Rhode Island state Medicaid and are provided for free by the state's Department of Health. Here, the state recognizes the unequivocal benefit of vaccinations to both personal and public health and diverts state funds accordingly. Rhode Island must do the same for abortions. It is the official position of the American Medical Association, the American College of Obstetricians and Gynecologists, and many other organizations of medical experts that abortion is health care and that access to it is necessary to ensure the health of American citizens. So why should Rhode Island be any different? A single working mother of 3 in Smithfield should have the same rights as a CEO in Providence. She should also have the same rights as a single working mother of 3 who lives 15 minutes away in Attleboro, Massachusetts, where state Medicaid already covers her abortion care. We must join the 16 other states who already recognize that the right to an abortion requires universal access to reproductive health care by passing S32. And thank you, and I can take any questions that the committee may have.
Thank you. Are there any comments or questions for this witness? All right. I don't see any. Thank you so much. Next up, I see Barth Bracey. You're up to testify. Sarah Murray and Wendy Becker. If Sarah isn't in here, we have Harrison Tuttle and Kamika Ross. Oh. Welcome to the committee. We'll start on my right. Welcome to the committee, Mr. Bracey.
Madam Chair and members of the committee, it is a sobering and lamentable fact that under this General Assembly, the preborn human child in Rhode Island has less legal protection than domestic pets or even livestock. Bills are filed annually in these chambers to further enhance legal protection for various species of life, some of which advance into law, while bills that seek to enhance legal protection for the most vulnerable and voiceless members of our own species fail. Not so long ago, even the proponents of legal abortion regarded it as an unfortunate but necessary evil. Now, the state-paid killing of underprivileged preborn human children is bizarrely proposed as a matter of, quote, economic justice, unquote, and simultaneously as a way for the state to save money. I pray that each of you will pause to consider the role you yourself play in this grotesque and degenerate state of affairs. Your personal role and responsibility, your direct participation in the deliberate taking of innocent human life comes into particularly sharp focus with respect to the present bill, 2023 S32, which will allow the state to pay for the killing of hundreds of preborn children annually using taxpayer funds. For you to advance this bill is actually worse than using your own credit card to pay for these abortions, because you propose to use money forcibly taken from people who deeply object to these killings. Abortion has never been, is not now, and never will be health care. because killing is not healing. The abortion industry itself reports that the overwhelming majority of abortions are elective procedures, not performed for the so-called hard cases of rape, incest, or life of mother, which may already be paid for in Rhode Island with state taxpayer funds. Abortion proponents have lectured us for decades that if you don't like abortion, don't have one. Now, pro-abortion state lawmakers want pro-life citizens to pay for the killings they have sanctioned despite our opposition. Regardless of whether you support legalized abortion on demand, I hope you'll at least consider respecting the conscience rights of your constituents and other taxpayers around the state who do not wish to be complicit in the wholesale slaughter of innocent preborn human life. Is it really so much to ask that those against abortion not be forced to pay for it? Thank you.
Thank you. Are there any comments or questions for this witness? Okay, I don't see any. Welcome to the committee.
Thank you, Chair and members of the committee. My name is Wendy Becker. I'm a faculty member at Rhode Island College, and because I am a state employee, my health coverage does not include abortion care. This matters especially to my 23-year-old, whom I believe should have access to all legal necessary healthcare procedures, including abortion care, should they need it. This is not legislation about legalizing abortion. We've done that. This is legislation about fairness and access, irrespective of income or insurance. Thankfully, Rhode Island has already decided the government should not have the coercive power to force someone into pregnancy or childbirth. However, our current policy of state employee health insurance and Medicaid denying coverage for abortion does exactly that, disproportionately affecting women of color and poor women, because for some, lack of funding is lack of access. We cannot continue to be a state where type of insurance is allowed to determine bodily autonomy, where health disparities are perpetuated, and where pro-choice doesn't always afford a choice. Access to abortion must be guaranteed to all Rhode Islanders as the decision about when and whether to be pregnant impacts every other aspect of our lives. Some have argued that they don't want taxpayer dollars being used to fund abortions. Obviously, taxpayers can't pick and choose how their money is used. That isn't and can't be how a government functions. I'm also testifying in opposition to all of the anti-abortion bills which perpetuate false information and violate the right to bodily autonomy. We cannot get sidetracked by ideologically driven bills not based in sound science. Let's not start creating public policy with alternative facts that are largely based in myth or religion. I urge you to, instead of considering these anti-science and anti-autonomy restrictions, I urge you to vote the EACA to the Senate floor. Thank you so much.
Thank you. Are there any comments or questions for this witness? All right, seeing none, thank you so much. Welcome to the committee.
Hi, thank you very much. Good afternoon or good evening. My name is Sarah Murray. I am here today as a member of the the Women's Fund of Rhode Island Policy and Advocacy Committee, and I urge you to pass RIS 32, the Equality in Abortion Coverage Act. When legislators signed the Reproductive Privacy Act into law in 2019, it was a monumental step forward for the protection of abortion rights in the state. However, those protections do not extend to all residents of Rhode Island, regardless of personal opinion. Rhode Islanders that receive health care coverage through Medicaid or work as a state employee are banned from using their health insurance to access abortion coverage. What this tells me is that Rhode Island is interested in serving the women and children of the state in name only. Until this critical piece of healthcare legislation is passed, Rhode Island is telling the women who work to keep the state up and running, the women who do the work to enact the legislature passed under this dome, that their health does not matter, that their choices do not matter. Until this critical piece of healthcare legislation is passed, Rhode Island is telling its underrepresented and underserved populations that their health does not matter. I keep hearing that the law provides abortion in instances of rape or incest or at the life of the mother. Why do women employed by the state need to face lifelong trauma or almost die for their lives to be considered something that we should protect? Research makes it clear that when women do not have access to abortion care, they are more likely to suffer financially. Additional studies have found that laws restricting access to abortion widen the gender pay gap for women of childbearing age by pushing them out of the labor force and into lower paying jobs. When Roe v. Wade first passed, access to reproductive health care, including abortion, helped lead to increased labor force participation. It enabled women to finish school, which increased their earning potential. It allowed women to plan and balance their families and careers. Let us continue this tradition and pass the Equality in Abortion Coverage Act. I would also like to say that I am vehemently against S397, S392, anything that is referencing unborn children and as pro-life, and I'm going to end there. Thank you for your time.
Thank you. Are there any comments or questions for this witness? Okay.
Thank you.
Thank you. Next up, we have Harrison Tuttle, Kamika Ross, Emily Olson, Melissa Devine, Charlotte Touleau, Robin Lind. Okay. I'm going to go ahead and introduce yourself. I just ran through a bunch of names, so I'll go back in case I missed anybody who's coming up to the room. So welcome. We'll start on my right, your left.
Thank you. Thank you, Madam Chair and members of the committee. My name is Melissa Devine. I'm a resident of North Kingstown, a constituent of Senator DeMario, and I'm here to testify in strong support of Senator Valverde's SB 32 that will provide abortion coverage for all women. This bill will repeal an exclusion for state employee insurance plans and the Medicaid program. Rhode Island needs to be inclusive in providing equitable health care for all women. This is, as the bill is written currently, systematic inequality, and we need to change that. Abortion is a heartbreaking and difficult choice made between a woman and her doctor. From its beginning, Rhode Island was founded on separation of church and state. Regardless of what your religious beliefs are, this is not a matter that should be decided by governmental control. And I also just have a comment. It's not a question for the senators. Looking at your committee, with all due respect, I don't see a doctor up there. So I think it should be left, again, to a doctor and their patient. Thank you for your time.
Thank you. Are there any comments or questions for this witness? All right, I don't see any. Welcome to the committee.
Hello, honorable members of the committee. Thank you for the opportunity to speak. My name is Charlotte Tulin, and I live in Cranston. I'm a graduate student at URI. My dad worked as a staff member at URI for over 25 years, and my mom has worked at URI for over 20 years. I basically grew up at URI, and I want to advocate for the URI community by urging this committee to approve the Equality in Abortion Coverage Act, S32, and to send it out to the floor for a full vote. Rhode Islanders should not be penalized with worse health insurance coverage just because they work for the state. Abortion is a private decision between a woman and her doctor. No one should be pushing private personal views on state employees and interfering with them and their families' lives. An abortion, uncovered, can cost over $600 at the minimum. At URI, there are staff members, URI state employees, who are making as little as $28,000 a year. The cost of an abortion can be a punishing financial burden on a working class family. Everyone deserves the right to make their own private medical decisions, letting them stay between themselves and their doctor. State employees should not be penalized in their health insurance coverage just because of their employer. Let's please stop treating state workers as second-class citizens. Let's stop interfering with their families' health care and their families' private lives. Please approve S32 and send it to the floor for a full vote. Senators, thank you for your time.
Thank you. Are there any comments or questions for this witness? All right, I don't see any. Thank you so much. Welcome to the committee.
Thank you. So I want to begin by thanking the members of the Senate Judiciary Committee for allowing me to provide testimony today. It is a great privilege to appear before you and support S32, Equality and Abortion Coverage Act. My name is Robin Lindy. I'm a professor of political science at Rhode Island College, and I also serve on the board of Amnesty International USA. But I speak here today in my capacity as a leader in Amnesty International PVD, Providence, and on behalf of our diverse group of Rhode Islanders to share the position on Amnesty International on issues pertaining to human rights and abortion access. I'm also speaking here in my capacity as a mom to 2 young daughters, one of which is here with me today, and both of which I hope will have the same opportunities to choose if, when, and how they become parents. As you may know, Amnesty International is a nonpartisan, non-governmental organization that has been working for human rights for over 60 years. We affirm that access to abortion is an essential component of a fair and equal society and is integral to realizing the full spectrum of human rights. We advocate for access to reproductive health and services provided in a manner that respects human rights, autonomy, and dignity as the right of anyone who can become pregnant. Amnesty PVD's support of the Equality and Abortion Coverage Act is based on a policy developed in consultation with human rights experts, medical providers, and the Amnesty movement, informed by years of research concerning women and girls whose lives have been shattered by restrictive laws. We demand that governments respect the reproductive autonomy of women and girls, and we campaign for safe abortion access for anyone who seeks it, without discrimination, coercion, or stigma. Around the world, approximately 47,000 women die each year as a result of unsafe abortions. This will not end until abortion is made accessible and affordable to everyone. We recognize that decisions around pregnancy and abortion have a direct impact on the full spectrum of human rights. Abortion should be treated like any other health service, and anyone seeking an abortion should be met with compassion and dignity. Abortion is a complex sociopolitical issue, and discrimination against this particular health service, by denying its coverage under insurance, perpetuates gender and economic inequality. In support of the Equality and Abortion Coverage Act, we advocate for the removal of all barriers to safe abortion and to promote reproductive, gender, and economic justice. Thank you.
Thank you. Are there any comments or questions for this witness? All right, I don't see any. Thank you so much for your testimony. Next up, we have Leona Davies-Nelson, Patrick Crowley, Beatrice Magiach. Welcome to the committee. We will start to my right, your left. Welcome to the committee.
Thank you, Madam Chair, and thanks to the members of this committee. My name is Wyona Nelson Davies, and I'm the Executive Director of the Economic Progress Institute. I'm here in strong support of S32, the Equality in Abortion Care Act, and I'm in support of it for a few reasons. The Reproductive Privacy Act of 2019 protects the right to an abortion, except it is an unequal system. and is unequal because that right that were provided in 2019 does not apply to those who are on Medicaid or state workers. There have been some talk about access is already provided to everyone. However, if access was provided, this would be a moot issue and we wouldn't be here at all. Taxpayers will not be here arguing as to why their taxpayer money will be going towards access to abortion. They are here because currently we have decided that those who cannot afford an abortion and those on public insurance system, those who work for the states are not worthy of protection that the Reproductive Act of 2019 provides. Also, as taxpayers, and the point have also been made, we do not get to decide where our taxpayer money goes. We do not get a checklist where we go down and pick and choose which programs we want to support. We also do not have a system that allows patients to go before every single taxpayer to decide if to make a decision on whether their medical decision is approved by that taxpayer based on a moral and religious grounds. Furthermore, the EACA protects reproductive justice. We should all have the right to personal bodily autonomy, including the right to make decisions about when and whether to have children. Others, taxpayers and legislators, should not get to decide what type of care someone has simply because they rely on a public insurance program. The EACA also values economic, racial, and healthcare justice. Medicare recipients who would be impacted by these decisions, and the numbers I have is about 80,000 people, and so we can clarify which numbers are correct. Most of those are Black and Latino residents. About 32,000 state employees would also be impacted. This bill helps us to close the gap in healthcare access. Furthermore, reproductive care as a part of our healthcare system does not operate in a vacuum. The lack of access to healthcare, including abortion care, has a ripple effect on other financial decisions someone has to make in order to meet their basic needs. And lastly, a right without access, and maybe we need to quantify what access we mean, meaningful, same, equal access, is not true and is not a complete right. The Reproductive Privacy Act does not fully protect access to abortion unless everyone have access. We need to make sure we send a message that those on Medicaid and state employees are deemed worthy of the protection we provided under the RFA. I ask that this committee vote in support of this bill, get it onto the Senate floor, and then to the governor. Let's pass the EACA and make this a true right for all Rhode Islanders. Thank you.
Thank you. Are there any comments or questions for this witness? Right, seeing none, thank you. Welcome to the committee.
Hello, thanks. My name is Beatrice McGeoch. I am a resident of North Kingstown. Thank you all, senators, for taking the time to listen to us tonight. I know there are many of us. My experience, I'm going to share with you in support of 32, is both as an educator and as a citizen. I'm a state employee. I work at CCRI. I supervise adult education programs. And one of the things that I've learned through 20 and more years at this point, working with people who have been failed by the K-12 system or come to our country as immigrants from elsewhere, I've learned that we have an imperfect system. You know, we have a lot of people who are striving for perfection. We have an ideal. We have a place we'd like to go, and then we have the reality. And the reason this kind of law and change is important is it helps us provide a fair footing for all types of people to deal with all types of reality. I myself, at a period of time, was on right care. I did not know at that time I would not have been eligible for an abortion had I needed one. But I was caring for a 1-year-old and a 4-year-old, and I was making decisions on a regular basis about food versus soap. And I am a very fortunate person. I'm well educated. I had the capacity, had something occurred, like an unplanned pregnancy that I was not ready to handle, I would have had the capacity to solve that problem. But on a regular basis, on the first of the month, when I went to the market with all the other people who were also receiving food support, I saw many people there. And I also see in my classrooms many people who maybe don't have the same resources and access. So the least we can do is put this out for a vote so that we can create a scenario that works with reality. We have what we would like as an ideal, but we have to provide for people now. Thank you.
Thank you. Are there any comments or questions for this witness? All right, seeing none, welcome to the committee.
Thank you, Madam Chair, members of the committee. My name is Patrick Crowley, and I'm the Secretary-Treasurer of the Rhode Island AFL-CIO, and I'm also the Government Relations Director for NEA Rhode Island, one of the 2 teacher unions in the state. And I'm here in support of Senator Valverde's Bill number 32. In the wake of the Dobbs decision, our national organization, which is led by President Liz Schuler, and we represent over 13 million workers across the country, said, we passed a resolution at our convention, and it read, in part, we believe all individuals should have quality health care and the right to control their own bodies, including equal access to contraception and reproductive health care. This is a union issue. This is a worker issue, and that's why I'm here tonight. I believe it was Senator McKinney earlier in questioning talked about the difference between different teacher groups in the state. So my union represents both teachers in the municipal sector and also teachers that work in the state sector. For example, the teachers at Davies and the teachers at the School for the Deaf are state employees. They don't get access to all the health care that their sisters and brothers that teach in South Kingstown, North Kingstown, Warwick, Cranston, Providence, et cetera, et cetera, et cetera, have, simply because they are state workers. From our point of view, that's an inequality within the system that needs to be overcome, because all of our members deserve the same access to health care across the entire state. And that's why this is a worker issue. If it's a worker issue, it makes it a union issue. Senator DeCoyne, you asked a question of a couple of witnesses ago about the numbers of folks involved. According to CMS, the Center for Medicaid and Medicare Studies, about 300,000 Rhode Islanders are covered by Medicaid right now. There's the single largest group in the state. The second largest group is people covered by Medicare. There are about 250,000 people. You know what the third largest is? People that get their health insurance through collective bargaining agreements, whether it's through them or through their spouse or their partner. So the labor movement is the third largest single player in the healthcare market in the state of Rhode Island. That's why this is a worker issue. That's why it's a union issue. There are about, you mentioned about how there's 8,000 state employees. It's a little bit more than that. It's their dependents as well. Under the state employee health insurance plan, it's about 33,000 lives that are impacted by that plan. So just in terms of how those numbers are accounted for, it's the number of plans and it's their dependents. And I think in specifically of our folks, that are NEA members at the Department of Health, even though their job is to make sure that quality public health is issued in the state of Rhode Island, they don't have equal access to health care by virtue of just where they work. So that's why the labor movement, that's why I'm here today in support of Senator Valverde's bill, and I would urge you to give it your full consideration and move it to the Senate floor for passage. I'd be happy to answer any questions.
Thank you. Are there comments or questions for this witness? Okay. I don't see any. Thank you. And next up we have Bella Robinson, Susan Kinnenberg. Oh, all right, thank you. Donnie Anderson. Giona Chico. Daria Lira Montaguia. How about James Italiani? Okay, we'll start on my right. Welcome, Reverend.
Thank you. I'm the Reverend Dr. Donnie Anderson, and Providence resident and the chair of the Rhode Island Democratic Women's Caucus. And I'm here today speaking on behalf of the Rhode Island Democratic Women's Caucus and our support of what we all know as the EACA. In my day job, I'm a minister and spent 75 years, well, I'm 75 years old, spent all my career in the religious sandbox. And I understand and appreciate that there are many people who've come before us today who have very serious and deeply abiding religious convictions. But as Reverend Jean Disleski shared with you in this packet of things, there are people who hold equally fervent religious positions that are of a different perspective. And it seems that we have made a choice to carve out one particular religious conviction and to give it a tax consideration or a consideration of how we spend our tax dollars to that one carve-out, ignoring all the other religious convictions that people may have about how the government spends money. It just doesn't make an awful lot of sense. And the practical reality is this. I know there's a lot of terms people throw around, we can argue terms, but here's the actual practical result. We have created a two-tier system when it comes to access to health care in this state. And in my view, that is shameful. All Rhode Islanders should have equal access to health care and to what is available to everyone, whether they are on private insurance or public insurance. And we would urge you to please pass this bill out of committee to the floor for the full Senate's consideration. Thank you.
Thank you. Are there any comments or questions for this witness? All right, seeing none, welcome to the committee.
Thank you. My name is Gianna Pacheco, and I am here today representing the Rhode Island chapter for the National Organization for Women. And we are in strong support of Senate Bill 32, the Equality and Abortion Coverage Act. We recognize that a person's ability to decide when and if to have a child is influenced largely by their health and economic well-being. And as an organization now opposes restrictions on reproductive freedom and inequality. Rhode Island has already affirmed the right to abortion, but it is still an issue of equity when a large portion of our people on Medicaid and state healthcare plans do not have the assurance that they will be covered if the choice to get an abortion is right for them. It is not up to you or any of us to judge someone based on their personal choices, circumstances, or lived experiences. It is up to them to make the decisions that are right for them. That decision should not be made for them when they cannot afford an abortion and their healthcare plan does not allow coverage. We have healthcare plans exactly so we can afford costly medical procedures when we need them. So it should not be true that some vital procedures are blocked because they might make some people uncomfortable. It is not their business. It is a personal healthcare decision. We can do much more to benefit the people in our state, and this is just one way where we can address one of the many issues of inequality and remove a discriminatory barrier that largely impacts low-income women. That is what I would like to see from our government, reinvesting in the people, helping those in need, and empowering Rhode Islanders to live their lives freely and safely. This isn't some sort of unprecedented bill. 16 other states cover abortion procedures through their Medicaid programs, including our New England neighbors, Connecticut, Massachusetts, and Maine. And just like them, in Rhode Island, we support the right to abortion, reproductive freedom, and the right for all people to make their own healthcare decisions, because abortion is healthcare. The House has already passed this bill, and the governor has indicated that he is ready to sign it. So now we turn to you to urge swift passage of this bill in the Senate to expand access to abortion coverage in our state. Thank you very much.
Thank you. Are there any comments or questions for this witness? All right, I don't see any. Thank you so much for your testimony. Welcome to the committee.
Thank you. Thank you for allowing me to be here. I'm Jim Italiani. I'm from Warwick, Senator McKinney. And I am a proud Knight of Columbus, along with my 2.3 million brothers. Our preeminent concern is life and the right to life, particularly the unborn. The reason why we say that is because if we do not protect the least of us, we don't protect any of us. That's what I'm asking you to do, is protect all of our society. Do not allow more evil to creep into our society. I've heard a lot here about choice, but what I haven't heard is most of the people don't accept anyone's choice other than what they deem ought to be. And that is simply not fair. Why force me to subsidize something that I believe is an inherent evil? Any more than I would ask you, why would you force me to subsidize the cost of marijuana? Why would you force me to subsidize the cost of fentanyl? All of them are inherent evils, as this bill is. Why not allow other people, if they feel this strongly, to donate to enhancing what they feel is not fair? Okay. Wouldn't that be much fairer? And why would we call this bill equity or equality? It's more racist or ebonics, because we want more poor, more minority people to get more, to kill their own kids, okay? And nobody has talked about, we've talked about the suffering of people that haven't been able to have abortions. What about the people that grieve about the loss of their child? An aborted child is no less of a loss. And it affects millions and millions and millions. Pardon me, not millions. We have aborted 1 billion children in this world. How many of those mothers and fathers now suffer the loss of that child? Please, please don't allow any more of that suffering. Let's take the time and take the money, instead of wasting it on this bill and causing the problems it would cause. Let's take the same amount of money, let's increase the quality of life. Let's increase our school system. Let's increase our roads. And speaking of the what are being called pro-life bills.
Sorry, that was the time. If you can just wrap up and finish your thought.
The pro-life bills are not pro-life. They're protecting kids from pain. They're protecting our children. Please, let's pass that bill and no to 32. Thank you for your time.
Thank you for your time. Are there any comments or questions? Okay. Next up, we have Gretchen Raffa, William McKenna, Kiki Latimer. Welcome to the committee. We'll start on my right. You can go ahead.
Sorry. Good evening. Chair Oyer, honorable members of the Senate Committee on Judiciary. My name is Gretchen Raffa, Vice President of Public Policy, Advocacy, and Organizing with Planned Parenthood of Southern New England. We serve nearly 9,000 Rhode Island patients every year. And we believe all people should have access to quality, affordable, and compassionate health care as a basic human right, regardless of who you are, where you live, your income, if you have health insurance, or your immigration status. That's why we strongly support and appreciate the introduction by Senator Valverde of Senate Bill 32, the Equality and Abortion Coverage Act, which will ensure that people can make the health care decisions that are best for them about their bodies and their lives without political interference. The facts are, abortion is healthcare, abortion is normal, it's part of reproductive health care, and it's one of the safest medical procedures that nearly 1 in 4 women in the United States will have by the age of 45. Yet despite the facts of this basic healthcare procedure, abortion rights affirmed by Roe v. Wade were overturned last June by the United States Supreme Court. And thankfully, Rhode Island has codified the right to abortion, and it's still legal in Rhode Island. Yet we know legality has never guaranteed access for all people. Even in our own state, hurdles like distance, money, time off, taking time off from work, finding childcare, lack of health insurance coverage and other restrictions have stood in the way of people's health despite having the legal right. And that's because of a policy called the Hyde Amendment that for 45 years has prevented federal Medicaid funding for abortion services, except for in the case of 3 extremely narrow exceptions, which you've heard tonight. This policy has created additional financial barriers for people who use Medicaid to access health care and disproportionately impact people with low income, women of color, young people, transgender, and non-binary people, all those people who have faced systemic barriers to health care. And that's why 2/3 of Rhode Islanders support passing the EACA to remove that barrier that is in place because of the federal Hyde Amendment, which is harmful and racist policy. And right now, access to health care has never been more vital. 1 in 3 women of reproductive age in the United States and more trans and non-binary people no longer have access to abortion in their state because 19 states have banned or severely restricted. Abortion is an economic issue for pregnant people and their families. And when policymakers deny people insurance coverage for abortion, pregnant people are either forced to carry the pregnancy against their will or pay for care out of their own pockets. That's why we strongly support Senate Bill 32, and it's overwhelmingly supported by Rhode Island voters. Every day, people across our state and this country make deeply personal decisions that should be private between a person and their medical provider. Those decisions deserve respect, regardless of the outcomes of their pregnancy decision, free from shame and stigma, and without political interference. And by passing this bill, we can ensure that abortion access is more accessible and ensures that the legal protections of the Reproductive Privacy Act actually can be achieved by all people that need it. We're also in strong opposition to Senate Bills 298, 347, 392, and 397. These bills, okay, thank you.
Thank you.
I see you, Chair. Thank you.
Thank you. Are there any comments or questions for this witness? All right, thank you for your time. Welcome to the committee.
Thank you. I'm Kiki Latimer. I'm the Executive Director of Choices Pregnancy Center in Westerly, Rhode Island, and I oppose on 32. For 50 years, we've heard the slogan that if you don't like abortion, don't have one. If you're against abortion, don't have one. And now we have this turn of the screw. If you're against abortion, don't have one, but please pay for someone else's. It is no longer enough that some members of the community sadly choose death instead of life for the preborn community. But now we are asked that the entire community be complicit, take part in this evil directly or indirectly by our tax dollars. And that's because abortion is big business. As Carol Everett, once director of the largest abortion clinic in Texas, has told us, after an abortion, women were routinely put on the lowest dose of the pill so they would become repeat customers. Every woman is a potential cash cow for Planned Parenthood. And now, as this bill makes clear, we want low-income residents, immigrants, people of color, and young people who are already disadvantaged to also be abortion cash cows. Of course it does. Abortion has never been about equality. It always targets these groups: minorities, blacks, poor people, the handicapped, women in distress, and the very young who have no voice at all, the preborn human person. Poor people shouldn't have babies. Planned Parenthood is always found in poor neighborhoods, targeting, as this equity bill does, poor women, minority women, poor families, minority families, making sure that they stop having live children. Abort them, and we will now pay for it, thus becoming indirectly complicit in the greatest human rights abuse of our time. Once director of Planned Parenthood right here in Rhode Island, Mary Ann Sorrentino, when asked why she referred to the preborn as a fetus, she replied, "You want me to call it a baby? Fine, I'll call it a baby. Everybody knows it's a baby. So what?" When a baby, born or preborn, becomes a burden on a woman, a burden on a family, a burden on a community, we are all called to help carry that burden, not pay to have that burden, that baby, exterminated. As a woman, I have a right to my body. and that right began when I got my body at my conception. You have been told by some here tonight that you are not doctors, and have been told that abortion is between a woman and her doctor. Well, you're not plantation owners either, and you know full well that slavery is wrong. Thank you.
Thank you. Are there any comments or questions for this witness? All right, seeing none, thank you. Welcome to the committee.
Push it up?
It should be up.
Should be.
Yes.
Oh, up, I see what you mean. I strongly oppose taxpayer funding of abortion. The phrase abortion is health care continues to be repeated, even though it is a nonsensical notion. To suggest that killing a patient by brain suctioning, beheading, crushing, poisoning, burning, or dismemberment by abortion is a form of health care is patently absurd. Should other forms of killing be considered health care? Is capital punishment health care? Is war a form of health care? Then there is the odd promotion of access to abortion as if it were a component of racial justice. This coming from supporters of Planned Parenthood, easily the largest private sector killer of minority babies in the nation. Rule number one, if you want to support racial justice, do not support organizations that kill minority babies. Racial justice is best promoted by those who desire the human flourishing of all. If arranging the killing of a preborn child is like hiring a hitman, as Pope Francis has indicated, then how is that so different from what you will do if you voted to pay for abortion by means of this bill? Doesn't this bill effectively provide the money for the hiring of many hitmen? If one were to pay for an abortion on one's credit card, one would be directly involved in the process of bringing about a death of a human being. Wouldn't your vote to put many more violent deaths of babies on the state's credit card, so to speak, be a far worse act in terms of magnitude of harm, even though killing even one baby would be horrendous? If you vote for this bill, you will be personally responsible for the deaths of many babies. Hope you do the right thing and vote against money for hitmen.
Thank you. Are there any questions or comments for this witness? All right, seeing none, thank you. Next up, we have Lisa Church, Annabelle Gibson, Paul Santucci, how about Gail Faraj Masla? Welcome. We'll start on my right, your left. Go ahead.
Madam Chair and members of the Senate Judiciary Committee, my name is Lisa Church. I'm a lifelong resident of Rhode Island. I live in Smithfield, and I'm a constituent of Senator Jacoyans. I'm also an employee of the state of Rhode Island. I'm opposed to Senate Bill 32. I support S298, S392, and S397. I'm not here to judge or condemn anyone who chooses to have an abortion. I'm not here to argue the 2019 law. I am here as a matter of conscience to oppose taxpayer funds and premiums from my self-insured employee health care plan from being used to fund abortions other than those already provided for under existing law. Personally, I am the mother of a special needs child. The normal prenatal screenings performed by my physician revealed no abnormality, and neither did family medical history. Upon the child's birth, the diagnosis, prognosis, and treatment was shocking. But over time, I became confident in my ability to care for my child, and that child thrives. At a routine visit with the child's medical provider, a specialist for this very rare condition, my child's doctor, not my doctor, the child's doctor, explained to me that additional tests would be performed in the event of future pregnancies to detect this condition. All the while, this beautiful child is sitting on my lap, smiling up at me with full trust in the eyes of the child. And I realized with shock and horror what that child's doctor was saying to me, offering me the option to abort a future child if that child had the same condition. I instinctively wrapped my arms around my child on my lap, and the doctor, sensing my great discomfort, said, well, you know, many families find this condition to just be too much of a burden. I ran out of that office with my child as quickly as I could, but I wondered, what would I have done if I did know my child had this condition before birth? What would I do when the doctor explained to me the great burden to me, my family, community, hospitals, education systems? I'm grateful it was not a decision that was presented to me, or I might never have known the great joy this child brought to me, my family, and so many others. You don't know what you don't have, but I do know. I do know. My child has a face, a name, an identity. My child is a member of my family in many communities. What an incredible void there would be to so many if I hadn't had this child. I urge you, as a matter of conscience, I find this abhorrent to be involved in this financial transaction and oppose S32.
Thank you. Are there any comments or questions for this witness? All right, welcome to the committee.
Thank you. Is this on? Yes. Okay, thank you. Good evening, everyone. My name is Gail Faramusla, and I am the Executive Director of the Mother of Life Pregnancy Center in Providence. I'm going to speak to you on behalf of my entire staff at the clinic, which is comprised of a medical director, OBGYN, licensed registered nurse, and a master's level counselor, all having over 37 years experience in their related fields. We are opposed to Bill number 32, taxpayer-funded abortions. I also will speak to you on behalf of my colleagues from 9 nonprofit agencies throughout the state of Rhode Island who have been meeting now for 7 years and doing roundtable discussions on how to best network with each other and provide free services to women and their families who are in need in our state. Besides the taking of a human being, there are side effects of both chemical and surgical abortions. If we are going to fight for the quote-unquote health of the mother, then we must look at the health of the mother after an abortion. How do we know this? We know this because we are the ones that they turn to after abortion. Excuse me for a moment. We are the ones that get the phone calls from mothers, grandmothers, whose daughters and granddaughters have had chemical abortion. They don't know what to do because the bleeding hasn't stopped for weeks. She's pale and she's passing out. They've called the clinic where the abortion happened and they did not receive help nor guidance. Often these young ladies need medical attention to keep them safe and heal physically. It is very difficult to listen to people testify that abortion is safe and that it has no negative emotional or physical effect when they are not the ones who hold the hands of grieving women after abortion. They are not the ones who watch a woman cry during an ultrasound when she sees her child's heart beating, arms and legs moving, and discloses in that moment that she has had abortions in the past and never knew that there was a heartbeat, that her baby was fully formed, that it's not just tissue, and she wishes, I can't tell you how many times a woman has said during an ultrasound who has had an abortion previously, she wishes someone would have told her the truth and did not lie to her. Using our tax money for abortions would not only go against what we believe, but also it's counterproductive to what we do in the community and helping people to heal and put their lives back together again after an abortion. This is something we should have the freedom to decide. And I can't tell you how many times we have dealt with the women who have come from abortion clinics, who have come from having abortions. It could be 2 years later, 10, 15.
That's the time if you can wrap up, please.
Okay, thank you. That's what I wanted to simply say. So please keep that in mind. And I thank you for your consideration before you vote.
Thank you. Are there any comments or questions for this witness? All right, seeing none, welcome to the committee.
Thank you, Madam Chair. My name is Paul Santucci from the great town of Smithfield, Rhode Island. As Senator Decoyan is also from. There's a couple of inconsistencies that I heard this evening that I just wanted to clear up. I happened to look up the Rhode Island Constitution, Article 1, Section 2, where there is no right to an abortion granted. And also, I think Senator Tokoyan had also asked a question with regard to health coverage. So I looked that up while I was waiting. According to Health Source Rhode Island, August 30th of 2022, Rhode Island achieved the lowest uninsured rate ever, the third highest insured rate in the country. So 97% of Rhode Islanders have health coverage. So I don't know why that inconsistency exists. I'm in favor of Bill 347. I'm in favor of 397, 298, and 032. I am against Act 32. I cannot underscore enough the importance of the pro-life bills. All you have to do is look to the Kermit Gosnell trial and the gruesome documentary of his disgusting clinic. According to the grand jury report in January of 2011, Gosnell had a simple solution for the unwanted babies he delivered. He killed them. He didn't call it that. He called it ensuring fetal demise. The way he ensured fetal demise was by sticking scissors into the back of the baby's neck and cutting the spinal cord. He called that snipping. J.D. Mullaney, who is the reporter for Bucks County Courier-Times, asked one of the court staff reporters why so few are interested. And the court staff reporter said, "If you're pro-choice, do you really want anyone to know about this?" Motioning to the filthy medical equipment set up in the courtroom. So just for those four pro-life bills, we absolutely need this. According to J.D. Mullaney, Gosnell pulls back the curtain from the inherent violence of abortion. You can't sit in that courtroom and learn about what abortion does to the unborn child and to the women in many cases. You can't sit there day after day and week after week and listen to that testimony and not be changed and not have a change of heart or at least reconsider your position. The last thing I will say in support of the pro-life bills, but also against Act 32, is that the Catholic Diocese of Providence offers adoption services, and I have not heard that since I've been in this Senate chamber. They also offer pre- and postnatal care to mothers and families. So the tired argument that poses the question, would God want a child to be born that is not wanted or cared for, is a false narrative. Gabriel's Call, who helps women who choose life, and Rachel's Vineyard, who helps women who had an abortion, are two agencies of the Rhode Island Catholic Diocese that help our pro-life efforts. Thank you.
Thank you. Are there any questions or comments for this witness? All right, seeing none, thank you all for your testimony. Thank you. Next up, we have Olivia Carana, Lydia Bartlett, Susan Moratini, Jessica Burton, Angela McCalla, Mary Chase Lee. Yep, come on. We will start on my right. Welcome to the committee.
Thank you, Chair Oyer and committee members for allowing me to testify. My name is Susan Moratini, and I live in Bristol, Rhode Island. I'm named Susan after my mother, and my middle name is Ernestine after my grandmother, my father's mother. When my grandmother, Ernestine, died from an illegal abortion in 1927, she fit well into the category of women that are currently uninsured for safe abortion coverage in Rhode Island. She was poor, living in a cramped tenement in Pawtucket with my grandfather, Andre, and their 5 children. Upon learning that she was pregnant once again, she and my grandfather made the very hard choice to terminate this 6th pregnancy. Since having an abortion was illegal in 1927, they sought a back alley abortion. On August 11, 1927, my grandmother, Ernestine, died from bleeding and infection from that botched abortion. She was 30 years old, and my father, Richard, the youngest child, was just 18 months old. Without a mother to love and care for them, my father's childhood was hell. He and his siblings were moved constantly while enduring a series of stepmothers, stepbrothers, and stepsisters. They survived, but they were not loved. As an adult, my father joined the Navy, met my mother, and together they had 6 children. But because he was hardened by such a cruel childhood, he created a barrier around himself and was not able to be a loving husband or a loving father. It wasn't until he entered palliative care at the age of 74 that he could let down his guard and show the loving man that he has always been. Please help make me the last generation that remembers what it's like to lose a family member to a back alley abortion and the repercussions for the family that was left behind. Please support all Rhode Island women in accessing safe, affordable, legal abortions by supporting SB 32 and allowing it to the Senate floor for a vote. Thank you.
Thank you. Are there any comments or questions for this witness? All right, seeing none, welcome to the committee.
Thank you. I'm Mary Chase. I represent the League of Women Voters of Rhode Island. Excuse me, and thank you for hearing our testimony. The League of Women Voters of Rhode Island, which is also part of the Rhode Island Coalition for Reproductive Freedom, supports the Equality and Abortion Coverage Act. The League, which is a national organization, there are leagues in every state, strongly believes that health coverage should be accessible and affordable for all citizens. It should include an equitable distribution of services, including services for abortion. I will not repeat the more eloquent arguments that have been stated of the need for this bill by Senator Valverde, the medical community, the religious community, and did I say medical community? But I did want to add a couple of things. In reality, Rhode Island's law, our current law, serves the same purpose as laws in states such as Texas and Mississippi, which have extreme abortion bans, since Medicaid recipients often cannot afford the cost, which has been laid out by previous people testimonying, and forego this health care. Long-term costs to the state due to unintended pregnancies resulting in birth also costs all taxpayers when the child cannot be supported by the parents. So that's a long-term cost if they do not have their choice. So I strongly urge you to pass S32 and send it to the floor of the Senate for a vote. The League is also against S392, 347, 397, and 298. These bills are an attempt to block abortions by legislating what is appropriate care, where it should be left to the medical profession to define care. The possibility of severe criminal penalties puts doctors and other medical care professionals in a very difficult position in how to respond to complex medical situations. The medical profession has its own guidelines and ethics, which is based on scientific evidence and governs its members. So I would ask that you vote against these bills. Thank you.
Thank you. Are there any comments or questions for this witness? All right, seeing none, welcome, Counselor.
Thank you. Thank you, Madam Chair, members of
Can you just make sure the button on the microphone is up? There you go.
I said, thank you, Madam Chair, and members of the council. My name is Angela McCalla. I am the Policy and Advocacy Program Director for the Women's Fund of Rhode Island. And I'm here today, really the Women's Fund of Rhode Island has a mission to invest in women and girls, and we do that through advocacy, research, grant making, and strategic partnerships designed to achieve gender equity through systemic change. Today, we are obviously here to join the hundreds of advocates and our partners in supporting Senate Bill 32, known as the Equality in Abortion Coverage Act. And so the EACA would essentially remove discriminatory limits to abortion health coverage based on the type of insurance, specifically for those through Medicaid and state health insurance program. So when insurance coverage is often denied, low-income people are likely to spend half or more of their monthly income on healthcare procedures alone. And the World Health Organization identifies the lack of money, inadequate dwelling, unsafe work conditions, and lack of access to healthcare to be among the social determinants of health that define inequality. These factors are worse for our immigrant population. And we also have we have to reduce the health inequities that exist for our immigrant population, our Black and brown, and especially those who are women and children. The lack of insurance access essentially amounts to a ban on pregnant people's bodies, particularly for low-income individuals. I want to remind this committee as well, states including Connecticut, Massachusetts, as well as Maine, all allow abortion care through Medicaid, and the majority of states do not prohibit state employees from having access to this important health care coverage. And so in passing this, I'm asking this committee to also join with our New England neighbors in helping to pass this. Just a couple of other reasons why. The first reason, better economic outcomes. So the financial impact of unintended pregnancies and subsequent births can be significant, and again, particularly for low-income women. Unplanned pregnancies are 5 times more likely for those at or below the federal poverty level. And research shows that women who can choose whether, when and where to have the children actually go on to attain higher education rates, increasing earning power, and narrowing the gender gap. In the state of Rhode Island as well, women make up about 51% of the population. So if we're not allowing them to have essentially that choice, you're pretty much cutting off almost more than half of your population from being able to participate economically. Also, in regards to okay, I'm sorry, can I just say one more thing?
Finish the sentence.
Okay. I also want to call in terms of adoption. We cannot say that adoption in foster care, as a person who formerly worked as a foster care recruiter, we have almost 2,000 children in the state of Rhode Island alone who have nowhere to go.
Thank you. Are there any comments or questions for this witness? Leader Dela Cruz.
Thank you, Chairwoman. One question that I do have, you mentioned Connecticut. What does their abortion law look like? How many weeks do they cover abortion until?
That's a good question, Senator. I would probably defer to my other counterparts that are here. I have not done the deeper dive in terms of Connecticut and analyzing their law at this time.
So I state this. If you're coming in your official capacity, I'm going to ask questions if I have it. And so because you are representing the Women's Fund of Rhode Island, if we're going to compare states, first of all, we're a different state. We don't have to mimic others. But if we're going to compare ourselves, Connecticut will allow up for 24 weeks. After that, they don't pay for it, only if it's the life of the mother that's in danger. So if we're going to compare ourselves, we should have information that's accurate. So, or at least we know what we're comparing it to. But again, I feel compelled to say this, is that when testifying, you said that there are bans on pregnant women's bodies to procure abortions. That's not accurate. In Rhode Island, it's legal. You can get an abortion whenever you want. And the state, if you are covered by Medicaid, or if you're a state employee, have access to coverage paid paid abortion in the instances of life of the mother, rape, and incest. After that, it's still legal, but the person would just have to pay for it. Thank you.
Are there any other comments or questions for this witness? Right, I don't see any. Thank you so much. And next up, we have Annabelle Gibson, Marcella Betancourt, Teresa Coate, Bethany Sorrentino. Okay, we'll start on my right. Welcome to the committee.
Hi, thank you. Hello, everyone. Thank you for allowing me to speak today in support of Bill S32. I appreciate the opportunity to share the importance of this bill with you today. My name is Annabelle Gibson. I'm a lifelong resident of Rhode Island, a recent graduate of the University of Rhode Island, and a fierce advocate for reproductive rights. As a young woman, I've come to learn that there is a misunderstanding that consent is like a contract to which there can be no amendments and from which there is no backing out. This is a scary reality for anyone, but I ask myself what I would do were I to find myself looking at a positive pregnancy test. Regardless of the decision I made, I could call my parents who would support that decision. Since I'm young enough to remain on their private health insurance, it would cover at least a portion of any medical costs. I would likely have to take time out of work, have to drive myself, or find a ride to a healthcare provider, and still have to pay out of pocket for some of these expenses. Additionally, I would have to face the physical and emotional consequences of terminating or carrying out a pregnancy, but I would still consider myself lucky. I'm lucky to have private insurance, a supportive family, and financial means to pay out of pocket if need be. Many people do not have these luxuries, and without the EACA, we are allowing those who are already at a disadvantage to fall further and further behind. As Rhode Islanders, we pay our taxes in order to make our state the best place it can be. This should include supporting those who need it most. We don't get to pick and choose where our taxes go. We must trust that our legislators will do with them what is best for our state, and I believe that you can do so by supporting Bill S32. Thank you for your time and consideration. Please consider voting in favor of this bill and making Rhode Island a better place for all.
Thank you. Are there any questions or comments for this witness? All right, I don't see any. Welcome.
Yes, hello. My name is Teresa Coate. I'm from Tiverton, and thank you for the opportunity to speak. I am strongly opposed to Bill S32. I'm opposed to my tax dollars being used for abortions. I also understand that, well, I'd like to propose a hypothetical situation. In the case of where people are saying people shouldn't be able to choose what their tax dollars are going for. So my hypothetical situation is, suppose a Rhode Island legislator submitted a bill calling for the reinstatement of the death penalty, capital punishment in this state. I can only imagine the chorus of justifiable indignation and vitriol from a huge majority of the politicians and citizens of the state. Imagine the heated discourse involved, including, and again, completely justified, the taking of human life, as well as the idea of taxpayer funds being used to fund it. That being said, I find it rationally impossible to justify the use of taxpayer funds to finance what is plain and simple, the taking of innocent human lives, and is nothing more than legally sanctioned infanticide financed by my tax dollars. I ask you to reject S32. I also want to make one other comment about Section 2 of the Rhode Island Constitution. As been mentioned, it says there is no right to abortion or the funding thereof. I think this could be a constitutional issue that would need to be explored. I understand there is a women's fund in Rhode Island where people are helping women to get abortions. I volunteer for Gabriel's Call for the Diocese of Providence. I know a lot of people who open their wallets and help women who have chosen, and men who have chosen to bring their children to birth who are less fortunate, and we help them. So go with the Women's Fund. Don't use my taxpayer dollars. Thank you.
Thank you. Are there any questions or comments for this witness? Seeing none, welcome to the committee.
Thank you. My name is Bethany Sorrentino. I'm a lifelong Rhode Island resident. I teach philosophy and ethics at the University of Rhode Island, and I have done so for the past 14 years. I'm here tonight in strong support of S32, and I urge you to support this bill in the name of religious freedom. This should not be a referendum on the morality of abortion, because as you know, in Rhode Island, we already have the protected right to access this procedure. What this is a policy decision to make accessing this right an equal playing field for all of us, no matter how much money we make, who our employer is, or where our health coverage comes from. This is why I urge you to pass S32 out of committee and to support it on the Senate floor, even if you personally would never consider seeking abortion care. If we truly have freedom of conscience here, your job is to protect the right of all of us to make our own decisions. This can only happen when we have real options to choose from, not a pretend right that is only accessible to those who can pay for it. If you care about religious freedom, it is vital that you support the removal of bans to accessing abortion care. Abortion bans such as the one being considered tonight impose one religious viewpoint on everyone, yet different religious and moral belief systems have different views on abortion. For example, an adherent of Reformed Judaism is obligated to have an abortion if their life is at risk because the health and well-being of the pregnant person come first. There is also no clear prohibition of abortion in Islam, and most Muslim scholars believe the mother's life should be prioritized over that of an unborn fetus. Hindu philosophy emphasizes the necessity of choice for adherents to make their own decisions. And remember, even someone carrying a wanted pregnancy can find themselves in the position of needing abortion care. Therefore, religious freedom and freedom of conscience demand access to safe abortion care so people can make their own decisions according to their own principles. And for an analogy to the objection specifically to taxpayer funding of abortion, as a pacifist, I am morally opposed to my tax dollars being used to fund the military. But in a pluralistic, democratic society, I accept that I don't have a line item veto to prevent this. I pay my taxes. The religious freedom that is guaranteed to all of us is not a sword for me to attack someone who is doing something that goes against my personal beliefs. My moral principles guide my own conduct. Our right to religious freedom is a shield to protect me and you from others dictating how we follow our own values. We must not legislate based on the spiritual beliefs of some of our members. I urge you to give Rhode Islanders equal access to our rights in the name of religious freedom. Thank you.
Thank you. Are there any questions or comments for this witness? Leader Dela Cruz.
Thank you for testifying tonight. In regards to religious freedom and paying for abortions, what other religious activities would you propose that the state pay for?
I'm not here to testify on that.
Okay, so probably not many, or if any at all. You mentioned abortion ban being proposed tonight. There is no abortion ban being proposed tonight. You mentioned Judaism, elevating the life of the mother. We currently cover that in Rhode Island law. You mentioned Muslims also elevating the life of mother. That's, again, already covered in Rhode Island law. And I guess Hinduism, whatever, other, I didn't catch all of them. So, again, just pointing out that some of the statements that you made were inaccurate, and it's important to be accurate in such an important and emotional topic. It's emotional for a lot of people. So again, we already cover it, and there is no abortion ban being proposed tonight. Thank you.
Are there any other comments or questions for this witness? All right, seeing none, thank you for your testimony. Next up, we have Sue Cienki, Olivia Carana, and Lydia Bartlett.
I feel like the price is right. My name just got called. Sorry. Little levity. Let's go.
How are you? We'll start on my right, your left. Go ahead.
Me?
Yes, you.
Thank you. Good evening. Thank you, Madam Chair and members of the committee. I'm here to testify in opposition to Senate Bill 32. This legislation makes citizens forced to fund elective abortions with their tax dollars. The abortion industry would like nothing more than to have taxpayers foot the bill for all abortions in our state. This legislation would provide an influx of money to the abortion industry, allowing to further market abortions in our state. There is a passionate divide over the topic of abortions. However, this legislative body should not use its power to support and promote elective abortions and compel citizens to support this type of violence. Rather, the government body should promote priorities that comprehensively support women and children and their families in ways that will assist and encourage families and make it easier to welcome and raise their children. This legislative body should want to advance a society that promotes life and hope for preborn babies and their mothers. Ultimately, abortion is not a compassionate response for a difficult pregnancy, one that pits a mother in crisis against her preborn child. Women and their preborn child deserve better. They deserve all of us to provide solutions that empower them to have a positive future. After the Dobbs decision, states have the authority to pursue legitimate interests in protecting preborn children, women's health, and medical profession by regulating and restricting abortions. Laws must strike a balance among competing interests and reflect this process. All states have provisions in their state abortion laws to protect a woman's life. Here in Rhode Island, we allow abortions up to 24 weeks. And in the case of a woman's health, rape, and incest, currently our Medicaid and state abortion laws cover those. The possibility, the permissibility of abortions and the limitations on it should be resolved without forcing citizens to pay for elective abortions. This legislative body must balance the relevant policy and equitable considerations in this area. This legislation undercuts the public interest by forcing taxpayers to pay for elective abortions. From once safe, legal, and rare to now over 1 billion babies killed by abortions, this legislation forcing citizens to pay for elective abortions is unconscionable. Thank you.
Thank you. Are there any comments or questions for this witness? All right, I don't see any. Welcome to the committee.
Are we on?
Yes.
Okay, we're good. Awesome. Well, good evening. Thank you for having me. It's an honor to be able to speak before you. My name is Olivia Corona. I am a citizen of West Warwick, so Senator Burke. It seems like we're kind of on a hamster wheel of redundancy, and I can tell in the dissolving engagement of the committee as we progress. And so I figured I'd take a different approach and hope to have your attention. I've come to reason with you tonight, and many in your intellect and stoicism, you may ask, what is this babbler trying to say? While others will discern that what I'm speaking is true. This may sound foreign to you, but when I considered how we even got to a proposition like this, taxpayer-funded elective abortions, I became aware of how many idols of this state there are. Money, sex, academia, power, and that's just to name a few. I've also become aware of how willing we are to sacrifice the foundational principle of this state concerning religious liberty on an altar of counterfeit equity. How far are we going to go to say that there's equality for one and constrict the liberty of another, to say it's equal? So before anyone interjects to say that this is not a religious issue, I propose that it is, because as I walk through the State House and I listen to the many testimonies, I see that in every way we are all very religious. Some are advocating for the God of self or pleasure, some the God of power, others the God of money. But I come on behalf of the true God, who in the name of progress has become unknown to you. So I figured since their objects of worship's all about this place, now would be a good time to provoke you in this. The God who made the world and everything in it, the one who has become unknown to you. He is the Lord, does not live in temples built by human hands, nor is he served by human hands as if he needed anything. And he also is sovereign, and has set a day when he will judge the world with justice by the man he has appointed. So many will mock, laugh, or respond in contempt to this. But tonight my hope is that you are awakened out of a willful ignorance to this truth, that this is not about a lack of abortion coverage. It never was. This is an unprecedented force on a boundary that should not be breached, because once we breach this one, there will be another one and another one and another one, and how far will we go? If you pass Senate Bill 32, you are calling judgment on this state. So please support Senate Bill 298, 347, 392, and 397, and please oppose Senate Bill 32. Thank you for your time.
Thank you. Are there any questions or comments for this witness? Senator DeLuca.
I just want to say thank you for your testimony.
My pleasure. Thank you for being here.
Any other comments or questions? Leader De La Cruz.
It's so great to see young people coming and standing up for what's right and advocating for their rights. Thank you.
Any other comments or questions? All right, seeing none, thank you. Welcome to the committee.
Thank you. My name is Lydia Bartlett. I'm a resident of Smithfield, Rhode Island, lifelong resident there. I'm a Spanish teacher at a school in Providence, and I also work at Rhode Island Right to Life. I'm here before you today to oppose Senate Bill 32. I do feel like there's a lot of confusion, chaos, saying one thing, meaning another, when the reality is pretty clear. That we're basically deciding whether we want to open the door to pay taxes towards elective abortions. And along with what Olivia was saying, how far is it going to go after that? Once you open the door, it's only going to get pushed more and more and more. So on behalf of myself, on behalf of women of a childbearing age, I do not support this bill to put my taxes towards paying for people to receive abortions. That's all I have to say. Thank you.
Thank you. Are there any questions or comments for this witness? All right, seeing none, thank you so much. Next up, we have Teresa Souza, Robert Dulski, Colette Cisnawi, do we have Cheryl Greathouse in here? Or Thomas Malloy? Come on. We'll start on my right. Go ahead.
Hi, my name is Terry Souza, and I represent Rhode Island Atheists. And I've listened to some fine speakers tonight, so I don't want to rehash all the excellent facts that they've mentioned, but I do want to talk about a little bit about separation of church and state, because in Rhode Island we don't have just, you know, everybody's a Christian or everybody's Jewish or everybody's Hindu. We have many people, and this law has to represent, whatever laws we pass have to be for all people, and they should be secular in nature. So when you go to the table and you vote on this, you need to be able to vote on laws that will represent all people, and a law and a bill that is able to support people who need abortion care. If some people have this support and some people don't, then it's not equitable. So everybody should have the opportunity. And as far as the other bills go, those are obstacles to abortion, and I don't see that it would be something that's necessary. We're talking about limiting freedoms and people's choices, and I don't think that we should be limiting that. Thank you.
Thank you. Are there any comments or questions for this witness? All right, seeing none, thank you. Welcome to the committee.
Thank you. Thank you. Thomas Malloy, I'm from Cranston. I'm just here as a civilian, and just have a short comment. I would say just because something has been accepted doesn't make it right, nor does it mean that we should pay for it if we think it is wrong. So I would say let's not fund, let's not approve Bill number 32. And I think there is one fact, I look at a lot of the arguments, but I think there is one fact that we should look at, and only one fact, and I think it preempts and negates all of the arguments that we're hearing, pro-choice arguments we're hearing for Bill number 32, and that is that the embryo has a DNA from the time of conception. This means It is a person, a human person. That DNA equals a human person. Every embryo has that human person DNA, not just at the moment of birth and through their life, but 1 minute before the moment of birth and all the way back to conception. So based on that, we should not allow this bill to pass. Thank you.
Thank you. Are there any questions or comments for this witness? All right. Seeing none, welcome to the committee.
Thank you. My name is Colette Sosnowy. I'm from Providence. Here as an independent citizen in strong support of S32. As you've seen tonight, many of us here strongly believe that abortion care is health care. And as it is practiced by physicians and other healthcare providers, it is health care. It is equivalent to other reproductive health care, including pregnancy care, fertility care, pregnancy prevention, and other sexual health care. We don't expect women who work for the state of Rhode Island or who have Medicaid to pay for their own gynecological exams or their pregnancy well visits. So requiring them to pay for abortion care out of pocket is clear discrimination. 2 years ago, the legislature passed the Reproductive Privacy Act, and the EACA is consistent with that law and should be passed accordingly with the best interests of the people in Rhode Island. I also strongly oppose Senator De La Cruz's bill allowing random inspections of clinics that provide abortion care. She compared it to random inspections of nursing homes. There is nothing to compare here. They don't provide equivalent services. Inspections of nursing homes include things like fire safety and kitchen hygiene, which is not what I think she had in mind. I work in the Department of Health, in the department that conducts nursing home inspections, and I'm happy to send over the protocols that they use. Abortion care is provided by licensed medical providers who practice standard of care. Providers and facilities are already regulated, and there's no justification for setting them apart simply because they provide abortion care. Frankly, it would be a misuse of funds, state funds, to put resources towards conducting unnecessary inspections. Needless to say, I also oppose the other bills, which I think are nonsense, that are designed only to put up more barriers. This is the first time I have ever testified before any committee, and I appreciate the opportunity to be heard. I have been a little disappointed, I have to say, at the amount of lecturing over listening that I have heard from the minority leader. Even so, I thank you for your attention.
Thank you. Are there any comments or questions for this witness? Leader De La Cruz.
Thank you so much. Appreciate the opportunity, Chairwoman. So in regards to inspections, it's disheartening to hear so many people against protecting women and ensuring that they're receiving the highest care possible. The inspections of healthcare facilities, and we'll talk about the nursing homes for a moment, that was used as an example. It's not just checking the dust on the drapes or the food that they're eating. It's also checking their bodies for bed sores and to ensure that they're being cared for properly. Abortion clinics should be held to the same standard as any other medical facility. Unannounced visits are the best kind of visits because you can check for any deficiencies. And so the facility is unable to prepare for that visit, and it's arguably the best way to go about it. In last year, I said McDonald's shouldn't be safer than abortion clinics. Restaurants, they're inspected. And if they're inspected, then I think healthcare facilities that provide abortions for women should be held to the highest standards of care because it can be dangerous. Chemical procedures, we want to ensure that women are safe. And lastly, you mentioned on the other legislation, they're nonsense barriers. I argue that ensuring babies that are born alive are given the proper medical care isn't nonsense. It's actually caring and considerate. And legislation that, again, inspects clinics, is kind and caring. So I disagree with you, obviously, but I do appreciate you staying this entire time and waiting for the opportunity to testify. So thank you for coming out.
May I ask you a question?
Are there any other comments or questions for this witness? All right, seeing none, thank you all for your testimony. Next up, we have Christina Contreras-Fox, Victor Bergeron, David Mitchell, go ahead.
Honorable Senators of the Judiciary, thank you for joining us tonight. I appreciate you staying late to hear everyone's testimony. I'll try to be as brief as possible. My name is David Mitchell. I represent the Little Flower Home. We provide housing for pregnant moms that don't have a place to stay. We receive no state funding. There are many ways that state funding could be used. Eugenics is not one that I would recommend. That's a business that the state should never get into. What does the government do? Over in the corner, I see this fine gentleman who would gladly risk his life to protect all of us. We have firefighters who will run towards a burning vehicle, and they don't just say, well, there's a clump of cells inside the car. There are a few major problems with this bill. First off, we can play the word game. On the House version of this bill, they renamed pregnant women to pregnant persons. I would suggest that the wording be pregnant mothers, because once after conception, one becomes a mother who is pregnant. Another problem in the bill is we talk about equality. In abortion, there is no equality. One patient dies every time in an abortion. Two people walk in, one gets killed by the abortionist, and then the mom leaves. She's still a mother to an unborn child that is no longer alive. So this bill should never go forward. There's been a lot of discussion about things that are legal. 160 years ago in this country, slavery was legal. The government should never have allowed slavery. 100 years ago, abortion was illegal in this state. A lot has changed in the past year. A real lot. 13 states now again protect the unborn child. Slavery was allowed because of the dehumanization of an entire class of people. Abortion is allowed because of the dehumanization of an entire class of people, the unborn. We all need to step up and think about what government is supposed to do. Government is supposed to protect their people, whether it's fire or police in every city of our state, everywhere. That's the purpose of what government is for. It should be protecting our citizens, not funding their demise. Thanks for your time.
Thank you. Are there any comments or questions for this witness? All right, seeing none, welcome to the committee.
Is this thing on?
Make sure that the button should be raised. There you go.
So my name is Victor Bergeron. I am a theologian. I'm a musician. I'm a filmmaker, business owner in the state. And I'm formerly a fundraiser and a speaker for Rhode Island Right to Life. I'm also a Catholic husband, and I'm a father of 5. I just want to start out by saying I was a little amused by the beginning of the hearing to hear Senator LaMontagne repeatedly ask questions specifically on Catholicism of an abortionist who seemed to claim to represent Catholics. I just want to say, if that's permissible, then I think it should be perfectly legit for me to identify myself as a doctor. If anyone has any questions for me about brain surgery, fire away. Coming back to reality, though, as a master's degree holder in theology from Providence College, I'd be happy to field any questions about theology. But what do I know? Perhaps I might make a better representative of Rhode Island's 636,000 Catholics than an abortionist. I'm pretty sure Bishop Henning agrees with me. Better yet, I certainly agree with him, and I think Senator DeLuca would probably agree with the bishop as well. There's been a lot of talk about not making moral cases for abortion, but in reality, everyone sits down and makes a moral case because all legislation is about morality. And to that point, I'd like to remind everyone of a film that was released in 2011 starring Gerard Butler. It was about a man named Sam Childers, who was a recently converted preacher who ended up in South Sudan fighting with Lord's Resistance Army to prevent the mass slaughter of women and children by the Sudan People's Liberation Army. There's a scene at the beginning of that movie where a young boy named William is forced by the Lord's Resistance Army to shoot his mother. He becomes a participant in the murder of his mother. That is called material participation in moral circles. And that is what I'm arguing against today. I'm arguing against Bill SB 32. We as taxpayers, anyone, should not be required to participate materially in abortion. Lastly, I would like to also address the idea that we can't choose where our tax dollars go. This hearing is about choosing where our tax dollars go. Senator McKinney had some questions seemingly arguing that we can't decide where our tax dollars go. Well, in any state government, we sit here and we decide what to do with our tax dollars, don't we? And this is one of the things that we shouldn't do with our tax dollars. And we're here to say that to all of you. It is absolutely reprehensible.
That was the time, if you can.
Thank you, I appreciate it.
Thank you. And I see we have Senator Cano and Senator Acosta here who wanted to come testify. So I'm going to let you both come in. I know you both have other committee assignments right now. So Senator Cano, welcome.
Thank you, Chairwoman. Members of the committee, I'm so happy to be in front of you in strong support of S32, which is ensuring that all Rhode Islanders have access to abortion care. As a woman, as a mom, as a legislator, and as a Catholic, I do believe that we have to make sure that the women have a right to choose, and our freedom of autonomy in our bodies is protected. Reproductive freedom is under attack in our country. And I do think that we have to eliminate our antiquated laws and policies that simply have no equity. And we have our Medicaid program preventing many of our employees, but also many of our community of colors and disadvantaged communities that are using the Medicaid program for having the right to choose. I have heard a lot of the testimony, and I don't want to be repetitive, but what I can tell you is that Equality in Abortion Care Act is about health care. Abortion care is health care. You heard that all night. And simply what we're doing here is discriminating against the most vulnerable members of our community that are accessing the program of Medicare. So I urge you to pass the EACA's bill today, but most importantly, I wanted to make sure that you do know that I don't take this lightly, because I know that in 2019, when I stood up as a pregnant woman voting for the Reproductive Privacy Act, I was facing very difficult moments during my pregnancy. And I'll tell you that time, I knew I was doing the right thing, being pregnant and voting for women to have the right to choose, because I knew that, and I was grateful that me and my partner had the autonomy to be and living in a state where I had a choice. Like, I was communicated after 12 weeks of my pregnancy that I carry a pre-genetic condition and that I needed to go to a genetic counselor. And that was the most scary news of my life. I wanted to be a mom very, very much, wanting to be a mom all my life, and then that call, without knowing that I was a carrier of something genetically wrong, was very difficult for me to handle. And it's no loss in me that at that time, while I was being pregnant, we were debating this very much topic, just to make sure that we protect the right for a woman to choose. And I'm happy to say that my partner and I obviously took the decision of continue with pregnancy, but I, as a person that I was going through fertility issues and genetic counseling myself, felt safe, happy, and very comfortable talking with my medical providers about the options that I did have. And that decision was very personal to me and my partner. And I thank most of the people that really joined the effort of passing Reproductive Privacy Act. And that now is time for us to make sure that there is some equity here and that our employees do not suffer that discrimination, and that everyone have the right to decide for them on and have the autonomy on making sure that this abortion care is health care. And with that, I will take any questions. I just think that it was important for me to share my experience with some of you that weren't here when I took that vote in 2019.
Thank you, Senator. Are there any questions or comments for the chairwoman? Leader Dela Cruz.
Thank you, Senator Cano, for your testimony and for sharing your story as a woman and the difficulties that you faced. I just have a couple of questions. You mentioned that we're under attack in this country, but let's zero down to Rhode Island. Do you feel that abortion access is under attack here in Rhode Island?
I think so. If we don't have equity in bipartisan support, it's still under attack. I would think that we do have the opportunity to join other states and also to be leaders in making sure there's equity with the reproductive freedom of women. And we wouldn't be having this discussion right now if our nation standards and risks wouldn't be trickled down here. We wouldn't have to do this if I didn't think that there is like a difference of opinion and there is some push back for legislators that don't think the same as I do.
Well, I'm not a U.S. senator or a congresswoman, so I'm going to stick to Rhode Island. And in Rhode Island, abortion is legal. You voted on it. I voted on it. Obviously, we voted differently. And abortion is legal at any point here in Rhode Island. So abortion rights aren't under attack in Rhode Island. And as well, I'll just leave it at that.
But not everyone, with all due respect, Senator De La Cruz, is able to access abortion at this time in Rhode Island.
Access is very much available. Funding is what's in question. And it's not discriminatory when we provide abortion for all women who are either their life is in danger, if they're raped or if it's a matter of incest. There's no discrimination there. And outside of those, anyone can procure abortion. So I disagree with you there, but as always, I appreciate your passion and your advocacy, even though we don't agree. But thank you.
Thank you. I think that access comes with funding. Access to funding, it is a equity issue. So I understand where you're coming from. I understand we disagree. I respectfully have a difference of opinion, but I do think that we should have equity to everyone in Rhode Island that need to make a decision in their own authority and their bodies. So thank you.
Right.
Thank you.
I'd just like to bring up one last thing.
Do you have another question?
Yes, I do.
Leader?
I do. In regards to equity, do you believe in equal access to everything, including, say, a child who's stuck in failing school? Do you believe in equity for that child, for the taxpayer dollars to go towards them to a better school, or is this just for abortion?
Well, at the same time, I would like to say that equity has to go with making sure that every child that goes to school have the same opportunities for access, high quality education, and we need to take care of our public districts first. But also, I would say that, do you agree that if we are
respectfully, I'm going to cut this off because it's not germane to any of the legislation that's in front of us, and we do have a number of public members, members of the public who still need to testify this evening. So I appreciate both of your comments, and I'm sure you will have many more discussions on this issue as we move forward. Senator Acosta, welcome.
Thank you, Madam Chair. I hold the honor of being the first senator to chair the newly renamed Rhode Island Black, Latino, Indigenous, Asian American, and Pacific Islander Caucus. RIBLEA today makes up 20%, roughly, of the General Assembly. And what we did this year was we sat around this table right here and participated in some good old deliberative democracy and fought and argued and debated over what bills would make our priority list. Now, I'm not going to hash out all the arguments that you've already heard for the last few hours, but the reality is that we went through hundreds of bills, as you very well know, that were submitted this year, and we whittled it down to 18. And one of the ones that was almost no fight at all was the EACA, because we recognize that a ban on insurance coverage disproportionately harms and marginalizes communities, including Black, Latino, Indigenous, low-income, rural, LGBTQ+ individuals, many of whom we represent. I myself represent the most economically disenfranchised community in the state. In finance, we were recently talking about the Medicaid recertification renewal process. In a city with a population of approximately 22,000 people, there are 13,000 folks on Medicaid in Central Falls. By not allowing low-income folks to access the same health care benefits that their more affluent neighbors are able to access, we are participating in discrimination. It is my responsibility to stand up, not just for my constituents, but for all the folks of our community. And so for that reason, again, we want to reinforce the fact that this is one of our priorities. The RIBLEA caucus demands that we take action on the EACA, and I'm happy to answer any questions. Thank you.
Thank you, Senator Acosta. Are there any questions or comments for this witness?
I actually had a question for Senator Cano.
We've moved on. Senator DeLuca, thank you.
I'll touch base after.
Any other comments or questions for Senator Acosta? All right, seeing none, thank you both for testifying. Next up, we have Jennifer Edgerchuk, Bill Dode or Bill Dade. Apologies if I'm not getting that correct. Paul O'Donnell. Leslie Bonnell. San Chappelle. Catherine Anderson. Gabriel Weigel. That does conclude the folks that I have signed up on my witness list. If there's anyone else who's still in the room and wants to testify, please see the clerk. With that being said, we will start on my right and your left. Go ahead. Thank you.
All right. Good evening, everyone. My name is Dr. Catherine Anderson, and I'm an OBGYN resident physician at Women and Infants Hospital of Rhode Island. I'm here this evening in strong support of Senate Bill 32, or the Equality in Abortion Coverage Act, because I believe in equitable access to health care services for all Rhode Islanders. In addition, I'm here to urge you to vote no on Senate Bills 347, 397, and 298, as these bills are designed to spread misinformation and to further stigmatize patients who seek these reproductive health services. I'm confident that everyone in this room understands that financial barriers to healthcare cause real harm and can be life-threatening for patients. At the bare minimum, they cause delays in accessing care, which can lead to further complications of any medical condition. This is true of cancer screening. This is true for access to diabetes medication, and it is also true of abortion, and that is why abortion is healthcare. As an OBGYN, I know that the health risks of abortion are much lower than those incurred during pregnancy. But this is only true if the safe provision of abortion is guaranteed. I have seen patients come into our emergency department recently bleeding heavily after taking unlabeled abortion pills that they received on the street from a friend because they could not afford to access receiving an abortion under close supervision of a trained medical professional like myself. In the pre-Roe era, there used to be entire units of hospitals dedicated to the complications of self-managed or back alley abortions. In the current era, abortions are performed in hospitals or outpatient facilities safely, with complication rates less than 1%. My family lives in Texas, and I am proud to live in a state like Rhode Island where abortion is safe and legal as of 2019. But I'm heartbroken that so many of my patients still do not have access to full reproductive services solely because of how much they make or who they're employed by. 25% of Rhode Islanders are on Medicaid, and under the current system, abortion is legal, but it is not a feasible option for many of these patients due to financial constraints. There is no right to abortion in Rhode Island until equal access for all is ensured. Bills like Senate Bill 32 are not a question of the morality or ethics of abortion, as we have discussed. They are a question of whether or not we are willing to address the racial and socioeconomic health disparities that exist in our communities. By placing such financial constraints on abortion, persons of color or those with low income are disproportionately affected, as was just stated. These are the very same people who the healthcare system is already stacked against. Safe and equitable access to abortion will improve birth equity in our state, and it will save lives. I also want to comment on the irony of Bill 397 specifically, as oftentimes these patients who are covered by Medicaid have to choose whether or not they can afford anesthesia or pain control in their procedures. It is in these moments that I feel the most limited in my ability to be a compassionate, kind, caring doctor. These patients deserve better, and every Rhode Islander does. Thank you for your time.
Thank you. Leader Dela Cruz.
Yes, thank you. You said you supported Bill 32 and that Bills 298, 347, 392, and 397, that you didn't support them because of misinformation. Can you point out to me in those pieces of legislation where the misinformation is?
I find that the research discussing the perception of pain in utero has not been well conducted or proven in our medical community. Our governing body, ACOG, does not recognize these research studies, and it is not part of our counseling for patients who undergo these procedures. So I think it's misleading, that bill in particular, to counsel patients regarding the findings of those studies. In regards to the inspections performed at healthcare facilities, I believe it was already stated that allocating funds to additional scrutiny for these clinics is unwarranted, as these are already staffed by trained medical professionals, again, like myself, and I've worked at many of these clinics. So I find them to be kind of guise for providing further barriers to care for patients who seek care there.
Thank you. Are there any other comments or questions?
I'm not.
Leader Dela Cruz.
Thank you so much. So you mentioned two bills, so I'm assuming that the rest are not misinformation, but they're accurate.
No, so in the bill that refers to the born alive babies, I believe that, in my experience in caring for these patients, oftentimes these patients have lethal anomalies that would not lead to a quality of life beyond hours of life, and it would be inhumane and cruel to the patients who gave birth at that time to provide heroic resuscitative efforts. It's traumatic to watch somebody have chest compressions. I hope few people in this room have been able to see that, but those bills in particular, I feel like provide misinformation, that this is something, number one, that routinely happens at Women and Infants Hospital. I can assure you that babies that are born alive who have the capacity and who patients have been counseled would have the capacity to have a meaningful quality of life are resuscitated to the full abilities of our NICU services, which are world-renowned.
Okay. So I didn't hear any misinformation there. No one stated that you're not providing resuscitative services, simply stating that they must be provided. You also mentioned in the same breath that you've seen children needing to be resuscitated because of the birth abnormality that they were born with, and you found it just unbearable to watch. But again, that's not misinformation. Healthcare funds, I can't read my handwriting, so I'm gonna have to skip that one. Research the pain in utero, I find it hard to believe that it passed the US House and the Senate, and that all of those individuals would be somehow hoodwinked into believing that the information that they stated in that legislation was somehow misinformation. That's a reach. I don't think I can agree with that. It's one thing to disagree with legislation. It's another thing to say that it's misinformation. So I appreciate you coming out and testifying, but thank you.
Senator McKinney.
Doctor, I'm not going to make speeches. Your time is precious, as is frankly ours. But let me just ask you a couple questions, because it seems as though there's almost scoffing at the suggestion that financial barriers, as you referenced, are real. Do you have patients you care for who perhaps don't get their prescriptions because of financial barriers?
Certainly, all the time. I've had hundreds of patients in those situations.
You mentioned cancer screenings. Do you have patients you care for who don't get their cancer screenings because of financial barriers?
Yes, and because of that, they present at more advanced stages and have worse prognoses.
Do you have patients you care for who don't get the reproductive health services that they should get? Even before we get to any point of discussing abortion, just reproductive health care because of financial barriers?
Certainly, and I believe abortion to be a part of that care, and that's why I'm here tonight.
Thank you.
Thank you.
Am I allowed to ask a question?
No, no, we'll go down to the next witness. Thank you. Welcome to the committee.
Thank you. Hi, everyone. My name is Dr. Gabriella Weigel. I'm also a resident physician in OBGYN, and I work at Women and Infants. I'm also here in the capacity of speaking on behalf of the American College of Obstetricians and Gynecologists. I serve as the Rhode Island section vice chair for junior fellows. Similar to Dr. Anderson, I'm here in support of Senate Bill 32 and in opposition to the anti-choice legislation that she mentioned before. Passage of the EACA is not a matter of whether you agree or disagree with the right to abortion. As we've discussed ad nauseum tonight, Rhode Island affirmed the right to abortion in 2019 with the Reproductive Privacy Act. Rather, passage of the EACA is a matter of equity. It's a matter of making rights already codified into Rhode Island state law an attainable option for patients with state insurance. And I just want to be very clear that legality does not equate with access. Financial barriers are a huge part of access. Access is an umbrella term that encompasses many barriers to care, but just because something is legal does not mean it's accessible to people in Rhode Island. So people with Medicaid insurance, it is currently very difficult to access abortion services in Rhode Island. We know from both extensive scientific evidence as well as my own personal experience as a physician that restricting abortion has significant negative impacts on physical and mental health, and it exacerbates existing societal and economic disparities. I want to highlight a story of a recent patient of mine. Let's call her Jessica. I saw her in the emergency room for severe nausea and vomiting associated with her pregnancy. She's 24, she has 4 children at home, and she confided in me that she simply cannot afford to raise another child. She's planning on terminating this pregnancy, but because Jessica receives Medicaid, she has to pay entirely out of pocket for her abortion care. Because of this, she's working every day hard to take care of her family, to save up for her abortion, and she's now approaching her second trimester, meaning she's no longer eligible for the medication abortion that she had desired. And with each week that the pregnancy passes, the cost of her procedure gets more and more expensive. In the meantime, she's required multiple visits to the emergency room for her intractable vomiting that's caused weight loss and electrolyte abnormalities. By comparison, if Jessica had private insurance, she would have already had coverage for abortion weeks ago. Financial barriers to abortion push people to obtain abortions later than they would have liked, or in some cases, not at all. And they're forced to carry pregnancies and potentially raise children that, for whatever reasons, those patients have decided that is not in their best interest. Passage of the EACA would ameliorate these financial barriers for this essential health care for patients like Jessica. I just want to briefly also mention why specifically I do not support the anti-choice legislation that has been proposed tonight. It does contain medically inaccurate information.
Sorry, that was the time.
Which you can find with citations in my written testimony that comes from multiple medical organizations, including ACOG, and it pulls all from peer-reviewed medical literature to support the medical inaccuracies of those bills.
Thank you. Are there comments or questions for this witness? All right, seeing none, welcome to the committee.
Thank you. I just wanted to say my twins were born 2 months premature. And
Sorry, can you just pull the microphone a little closer, make sure the button is up?
Hello?
That should be it.
Hi. My twins were born 2 months premature, and they were actually at the Women and Infants NICU. They were much smaller than a full-term baby. They were 2 months premature, but I also saw babies that were significantly smaller. I mean, tiny, much smaller than I ever imagined would be in the NICU, and I would walk by them in the hall, just astounded how tiny they were. So I don't know, these are some of the same women, and the other medical professionals are the same ones who are working so hard to keep those babies alive. So I would ask really what the difference is, other than the mother's ability to understand basic cause and effect of our fabric of reality, which is that intercourse leads to a child. So that's the question I wanted to ask them about, was about those tiny, tiny babies that they're fighting to keep alive in the NICU. First of all, I will not pretend that abortion is a health care, or freedom issue. The entire paradigm in which this debate is taking place is a fraud. Abortion is a wretched curse. 17 years ago, I had my first abortion, and 16 years ago, I had my second abortion. I was under society's pro-abortion spell that abortion's not a big deal, that it's even a good thing, that it's some sort of tool to use to fix our issues in society. Therefore, I had zero recognition of how evil those abortions were. I was under the same spell that seems to guide every single pro-abortion statement uttered today. It's heartbreaking to hear how shallow, short-sighted, small-minded, and completely lacking of spiritual discernment these pro-abortion statements have been. They all sound in one way or another like me in my early 20s. Back to my abortions, I regret them profoundly. I wrote this while I was waiting for hours. And I'm deeply remorseful for killing those children. The 2 abortions I had were the 2 most horrific acts I've ever committed and the 2 most traumatic experiences of my life, and they caused me inexpressible personal pain. I know that if abortion had not been available to me, not only would I not have killed those 2 babies, they would never have been conceived because the relationship itself was regrettable. I used abortion as a license to sin, or for those of you who detest that word, act immorally and irresponsibly. And I know the vast majority of women who have abortions do the exact same thing, albeit at various levels of awareness or lack of awareness. Abortion is not compassionate, it is the ultimate act of selfishness. I know it's certain that many of the people in this room have had relationships that they regret, like marriages that led to divorce, which bore beloved children whom they could never regret. I know that if abortions are made free, there will be more of them, and that sickness will spread through many areas of society. Even the more moderate pro-abortion argument that abortion is an unfortunate but necessary emergency tool that holds our society in better form is an evil lie. Abortion encourages sexual immorality, promiscuity, confusion, aimlessness, vanity, lust, pride, and a sense of godlessness and meaninglessness. Is that what you want in our society? Maybe you need to sincerely ask yourself, do you want your children and grandchildren to grow up learning the most basic fundamentals of our reality be true? That life is sacred and purposeful, that the relationships they choose to create and nurture have meaning, and that sexual intercourse naturally leads to the
Sorry, that was the time. If you can wrap up, please.
I have a lot more.
That everyone else has kept on time tonight, so we need you to wrap up.
Treating abortion as murder will help to heal every sickness in our society, even from fatherlessness to poverty and even rape. And I'm not ashamed to plead the blood of Jesus over this entire situation because I recognize this for what it really is, which is sanitized, suited up,
Thank you. You can email the rest of your testimony. Thank you. Next up, we have Sandra Bouchain.
Wait, you called our names earlier, but we had to run down from upstairs, so we just got here.
Okay.
My name's Leslie Bennell.
That's okay.
Okay.
Yep. Sandra Bouchain. And then, yep, Leslie, if you want to come on up. And San Chappelle. We'll start on my right.
Thank you very much. As a retired nurse, I do not support or want my tax dollars to pay for abortion on demand. Bill 2023-50032, Equality and Abortion Coverage Act. I do support the pro-life bills up for a vote. Born Alive Infant Protection Act, Pain-Capable Unborn Child Protection Act, and require Health Department for the state to inspect abortion centers. I am pro-life because I am pro-science. Life begins at conception because social justice begins in the womb. Being a burden on someone is never a justification for killing them. Because I am pro-woman, abortion degrades women. Abortion never empowers women, only men who exploit them. There are many choices in this day and age to prevent pregnancy. Contraceptive medication taken in monthly fashion, an IUD inserted into the female's genitalia to prevent pregnancy, the use of a condom or a spermicide, and of course, the old-fashioned way of preventing pregnancy, don't engage in sex. Take responsibility for your actions. When a child is killed in gun violence of any kind, the masses of people are appalled by this senseless act, as they should be. Out when a woman is contemplating the killing of her own fetus, this is okay and no big deal. Where is the logic in that? Please, senators, do not pass this legislation. Thank you.
Thank you. Are there any comments or questions for this witness? All right, seeing none, thank you for your testimony.
Thank you.
Welcome to the committee.
Hi, my name is Leslie Bennell. I am a Providence resident, and I have raised my daughter here. I am here on behalf of the board of Planned Parenthood Votes Rhode Island. And I just want to speak to the fact that I keep hearing all these things around me and want to point out I am one of these women that you guys keep talking about. A poor black woman who is a mother, who works very hard and does not make a lot of money. And on top of that, I'm here to talk about the reason why I had to have an abortion. And that is because birth control failed me. I have a daughter, and at the time she was 2. And at that moment, I unfortunately became pregnant again, yet I could not afford another child. That is not something that anyone else can decide for me anyway, because it's my decision. And the fact remains that as a poor person, I was in no position to be forced to have a child because other people find it offensive. Not to mention the fact that someone over here talking about how I have to make a decision for myself means I'm a bad and evil person. This is ridiculous. I am a real human being, and I deserve all of the same access as any other human being who has either insurance or not, has Medicaid or not, is a femme person or not. And this is ridiculous to sit here and listen to many, many white people explain what black people need. There's some sort of convoluted conversation about slavery. It is just as offensive to use slavery in the same word and in the same sentence of medical care. I don't care what anyone's opinion is about what they feel about abortion. And as far as I'm concerned, I resent and am offended by the fact that as I sat here and listened to everyone talk about people like me, and from what I can tell, obviously don't know anyone like me, even though there are plenty of us in this state, I really, really, really need to point out, we are people. We are right in front of you. I am not a made-up, statistic. I'm a human being who had to make a decision, which, by the way, I did not take lightly. I was not using abortion willy-nilly because I'm a hoe. Now, excuse me, but I will not sit next to someone who will actually degrade a person like me who had to make the worst and hardest decision of their life. And by the way, it was the right decision because I was able to afford to raise my daughter so she could get a scholarship, so she could go to college, and now she can go to medical school. I focused my attention on the child that I had and who I needed to take care of. And I will not apologize because birth control failed me and I was able to access the things that I needed to access. Thank you.
Thank you. Are there any comments or questions for this witness? All right, seeing none. San, welcome to the committee.
Hi, I'm San Chappelle, resident Riverside. I wrote in some testimony, but I listened to a lot of things, but I think that what we're talking about is financial equity. And when I read through the Bill 32 again, it clearly is showing the cross marks of the red and the adds in the blue, and the cross marks of the red is taking away the exclusive policy of the exclusion of abortion. So what we're talking about is financing, making abortion affordable for those who need to have access for it because they are not able to access it through the Medicaid system and, or the Medicare, I always mix those two up, and those who are on state health service insurance. So it is about equity. It is about, yes, we can choose how our tax dollars are used. You all, as the legislative body, are the ones that get to help us make these decisions. We, as individual citizens, can't check the box, yes, I want more guns, I want more police, I want more, no, I don't want abortion. We're talking about health care, we're talking about funding, we're talking about making it a more equitable system. I think in the idea that my neighbor here was talking about excessive moralism and judgment, we need to get beyond that. And we need to provide care for those that need it. Thank you.
Thank you. Are there comments or questions for this witness? All right, seeing none, we did have, thank you all for your testimony. Rabbi Howard? And then if there's anyone else who came in, I know that some folks were downstairs when I called their name, so if there's anyone else that I missed, you're welcome to come up. Otherwise, Rabbi, you're going to be our last witness for this evening. Oh, come on up, sir. Rabbi, we'll start with you.
Thank you. Yes. My name is Rabbi Howard Voss Altman, and I'm the spiritual leader of Temple Habonim in Barrington. And I'm here to speak on behalf of the passage of the EACA. When religious people speak about abortion and the right to abortion, they speak with sincere conviction. They speak with the conviction of a theological position about when life begins. And for my faith, human life begins based on texts and on commentary on that texts, begins at birth. Not in the womb, not during the development in the womb, but rather at birth. For Jews, our scripture clearly state that human life begins at birth, and that before that, it's not life. It is potential life. My friends, in 2019, we passed a law stating that the Reproductive Privacy Act would indeed protect a woman's right to choose. Indeed, this law would enable that law to have come to fruition. In other words, a right isn't really a right until one can actually access that right. As such, rather than discuss religious and theological views, which we are not here to actually debate over, we are here to actually debate over access to health care, a procedure that is indeed vital to a woman's health and to her sense of autonomy and her sense of personhood. And accordingly, when we are debating not a theological question, rather an access to health care. And I hope that we can maintain that distinction, because my theological views are just mine. That's all that they are. And someone who believes that life begins at conception is also presenting a theological view. It's not truth. It's rather a theological perspective. And I hope that we can separate those arguments and recognize the debate is about an access to health care and personal autonomy to make decisions about health care for everyone, not just those who can afford it. Thank you.
Thank you. Are there any comments or questions for this witness? All right, seeing none, welcome to the committee. You are our last witness for the evening.
Am I the only one that wore a hat?
I think so.
Good evening, everyone. Paul O'Donnell, teacher, poet, storyteller, Roman Catholic, political activist. That's enough. I support EACH. How did I come to this conclusion? It's a spiritual way through something called conscience, reaching to my conscience. I'm a Catholic. If I hear something from the hierarchy in the church, I have a right to reach into my conscience, the deepest part of my soul, if you will, and find out the answers based on everything I know. And that's what I've done to be here tonight. All the specifics I have supporting my position has already been said. The people who said it to you, in my opinion, are probably the most caring, loving, spiritual people that I've met in many years. So it was a blessing for me to hear them. In terms of, this is what I believe in my conscience, and I'd be interested to know, what about your conscience? And finally, you remember the Supreme Court decision of separate but equal back in the 1950s. It had to do with public schools, I believe, in the South. People considered them equal because they were, even though they were separate but equal. There was a black Supreme Court justice that we all loved in my neighborhood named Thurgood Marshall. I believe he was on the committee to study this case. There was also a Supreme Court Justice, Earl Warren, that helped out a lot too. And the decision, separate is not equal. In the same way, tonight, the analogy is we're missing out on equality here. And I think we all need to look within ourselves, look within our conscience, dig deep, and get your answer.
Thank you.
Thank you so much.
Thank you for your testimony. Are there any comments or questions for this witness? Seeing none, that does conclude the public testimony on this legislation. I would entertain a motion to adjourn. Oh, sorry. Well, if you want to come forward, come forward.
Oh. Yeah.
My name is Bob Ide. I've lived in Rhode Island all my life.
Oh, Rob.
Sorry, sir, can you tell us your name again?
Press it right there, Rob.
I spend my free time praying for this committee.
Thank you.
You know, there was a guy called L.M. Mencken made the expression, the most dangerous animal is a compassionate legislature. And I wonder if I'm looking at one right now. After listening to all the people that spoke tonight, they seem to have, want to support this bill more out of compassion than reason. But the law is not about compassion. It's about what is right and what is just. So I just hope when you rule on this, you don't rule out of compassion. You rule out of what you know is right. It's not always easy to do what is right. That's all I want to say.
Thank you, Robert.
Thank you. That does conclude the public testimony on this legislation. We have already held all of the bills on our committee. I would entertain a motion to adjourn, moved by Senator Dela Cruz, seconded by Senator DeLuca, and the entire committee. We are adjourned.